Good morning, ladies and gentlemen. Okay, I would like to thank you all for coming into this wonderful conference that has been prepared by Makerere AI Health. I would like to thank Dr. Rose in her leadership for leading and guiding us up to this day when we can see this occasion unfold. I would like to also thank each and every participant who is here. I am seeing a couple of both medical and academic doctors. I'm seeing very interesting persona in students who have also come to join us. I've seen people from the civil society joining us. I've seen persons from public sector also coming into this session. This is a multi-pronged session, and I'm sure we're going to get a lot from it. I'm also cognizant of our representation from the Office of the Vice Chancellor, Makerere University. We really appreciate you, Professor Buinza, for coming in. We appreciate and cognizant of Makerere College of Computing, right now represented by our Dean School of Computing, that is Dr. Joseph. Thank you very much. Just so we get into the process, in case you want to make interesting phone calls, we have two places you can visit. On my right, on the outside, straight up to the end, you can go and make a phone call from there, whether long or short. And also on my right, straight on the outside, you can do so. Hopefully you understand my language. You got my language, right? Cool. I would like to also recognize the entry of our principal, College of Computing, Professor Tony Oyana. Thank you for coming, Professor. And you have a seat that is being saved for you here. So today is the 28th of November 2024, and we are here on a very important mission, building a strong ecosystem for AI in African health, from research to practice. With this, it's a theme that resonates with what we are going to do today, and I pray that you follow us from start to the end, because we are going to have very interesting sessions, workshops, panels, and all these are going to be informing us on what we are going to be doing into the future with regard to health and artificial intelligence. All the distinguished guests, esteemed speakers and colleagues, it's my honor to welcome you to this AI Health Conference under this theme. And one of the key things in this theme is from research to policy and practice. Today, we gather to explore how artificial intelligence can revolutionize healthcare across Africa, bridging the gap between innovation, policy, and practical implementation. As we engage in today's sessions, let's reflect on how we can collaborate, harness AI for equitable, sustainable, and impactful healthcare solutions across the continent. One thing that will need to resonate with this is the fact that we're talking about healthcare in Africa. And I think it's a very important aspect. I've seen a lot of conferences this year having that feature of Africa. And I think it speaks a lot because Africa needs African solutions, and I think that is very key. So contextualizing everything to African affairs is very key. So with this regard, I would like to just give you a quick preamble on how far we've come since we started this journey at AI Health Lab. AI Health Lab was launched on 30th of May, 2024, and under the leadership of Dr. Rose Nakasi, who is also a lecturer at Makerere University College of Computing. following to this, we have seen us go to places with our current project, Ocular. We've gone to Google Impact Summit. We've also gone to the UN Summit of the Future at the UN headquarters, and under the main theme, AI, the Equalizer. For those who have watched the movie Equalizer, I think you know what it means. We've also visited New York, and we went for the 79th UN Geoscience Summit under the theme Reciprocity in Multilateral Research Collaboration. We've also been able to go onto our own health innovation conference hosted by IDI, Makerere University, and we were part of a panel on blockchain and AI in emerging technologies. We've also been part of the Data Science Africa in Uganda, and we were able to present under the Responsible AI in Healthcare. We've also been, we attended a session in Health Tech Hub, where we were handling a session on nurturing AI innovation in health, where Dr. Nakasi represented us on the panel. And of recent, we have also seen us receiving an award courtesy of Words That Count, and we were among the three recognized, the lab was among the three that were recognized for exceptional use of ICTs and innovation to support healthcare. We are still young, but you can see we are already moving. So fast, so quick. And with this, we would like to appreciate the guidance of the college and Makerere University for this purpose. With this, I would like us to begin this session, and for that to happen, I would like to welcome Dr. Michael Katerega to give us a quick prayer, and then after the prayer, we are going to have our anthems, and after the anthems, we shall begin the sessions officially.
We can humble ourselves and we pray. Mighty Father, we thank you for this opportunity to gather here, to share ideas, to be inspired and inspire. We pray that may you guide us through our work, and how we pray that may this conference bring clarity to our thoughts, openness to our hearts, and may we be able to meet the challenges in health. We pray that may it contribute to the health of our country. We have prayed in the name of Jesus Christ our Lord. Amen.
Thank you very much, Doctor, for that prayer. I would like now to ask all of us to please stand up for our national anthems.
From north and south, oh, and mighty, the walls are round thee. Great, great and mighty, the gates beside thee.
Okay, we may take our seats, please. Thank you. Sorry. At this moment, we would like to deep dive into our sessions. And for us to be able to understand what we are going to be doing, we shall start with our colleague, Mr. Solomon Sumba, who is a highly skilled software engineer with a proven track record of success in development of web and mobile applications. He is also a talented researcher with a strong focus on machine learning and computer vision. Solomon, we would like to welcome you to take the floor for the next session.
All protocol observed. Good morning, everyone. Just waiting for the slides to go up. All right, so my name is Solomon Sumba, like Eugenia has introduced me. I'm going to be talking about the work that we do in the lab. That's the Makere AI Lab, AI Health Lab. And then try to present some of the results that we have from the different projects that we do. So I'll begin with Ocular. All right, so under Ocular, the two main objectives are to develop an AI-based standardized approach for deployable field microscopy diagnosis. That's for malaria, tuberculosis, and cervical cancer. And then build a computer framework to aid in surveillance. Okay. So I'm going to go through the whole process of what we intend to do, right from having gadgets that allow us to collect the data from the different health centers, and then developing the models that we deploy on these phones, and then how that integrates into the whole protocol with what happens in the health centers. So because we have so many smartphones around, we can get this cheaply. I think you can get a smartphone at as low as maybe 100,000 Uganda shillings. So we thought that having tech that can sit on the smartphone allows us to be able to reach as many centers as we can across the country. And then integrating these smartphones and microscopes. So to do that, we needed a way of attaching the phone onto the microscope. So we designed a 3D printable adapter that you attach to the microscope, and then be able to attach the phone and be able to deploy all these models and do diagnosis for the disease that we'll talk about later. So this empowers the health professionals because before what would happen is that when you visit a hospital and maybe you want to be checked for malaria or TB or cervical cancer, it takes about 30 minutes to analyze the slide that has been stained. So what we want to do is to improve the productivity of the technicians. that instead of spending 30 minutes looking at a blood slide, with the AI model, you can take about maybe 2 minutes max to have your results back. And this also reduces the queues that you'd have for patients waiting for their results. And then because you're using a machine, it doesn't get tired like the way the technician would get tired if they're looking through the microscope. So we believe that with this, we can be able to improve the health outcomes across the country. Yes, so this is the flow. So we are using computer vision, and what that is basically being able to train the machine to see like the human sees. I know there have been, broadly AI has different categories, so we are using computer vision to be able to train the machines to be able to see what the technician was seeing when they look through the microscope. So what you see on my, okay, this will be on the first part that shows the advanced imaging technology. So those are the parts of the adapter that we have. These are 3D printed, and since all this work has been done by a team that is within the room, so the 3D printing has been done by Aloysius, who is somewhere at the back. He was able to come up with the designs for this, and what you're seeing is the different parts, and then the complete part that is later mounted onto the microscope, where we mount the phone as well to be able to do this diagnosis. So after designing the 3D adapter, we use it for data collection. So for data collection, we use a normal Android application that is able to capture for us the images that are seen on the slide that has been stained by the technicians. So what you see in the second image is the complete setup where the adapter has been attached to the microscope, and then we have a phone that has this application running. So we take these images that we later take to the technicians to annotate. By annotating, I mean the experts have to mark for us the areas of interest. So if we're detecting parasites, they have to be clearly marked out. If it's cervical cancer, they have to draw maybe polygons around the areas that are cancerous. So this example here you see is when the model has been trained, and then it's able to detect the parasites. And then, of course, we want to improve the healthcare outcomes. So if we train so many professionals, that means we're able to reach also many patients. All right, so again, this is the setup, what I was talking about. So you have the 3D printed adapter that is attached to the microscope, and then you have you're able to take the images and be able to receive a diagnosis for a given blood smear. All right, other examples of, so first we have the parasite identification. So what you see in white is what the expert annotated, and then what you're seeing in red is what the model was able to detect. That's for malaria diagnosis. Then the other side is for cervical cancer. So where you see the bounding boxes, those were mappings of the pathologists showing us what the cancerous section of the image were. And that work has been done by the team there, Jeremy, Cosmas, and Benjamin. Then the other thing that we're looking at is automating the way teaching is done in microscopy. I think the gold standard would be that a professor stands up here and then they tell you whatever they see, that what I see is this, and then students can agree or disagree. So what we want to do is to automate this in such a way that whatever is being seen by the professor can be seen by the students as well. So in this we are having a mobile application that would support taking of the images from the microscope, and then the students will also have the same application, so they will be able to see what the professor is saying in real time to support the teaching of microscopy. so that in case they identify a given parasite, the students can easily see that that's what is being talked about. So we are trying to do this, and the end goal is to deploy it in the different teaching facilities to aid in the teaching of microscopy across the country. The other thing we are doing is also this work is being done by Chodrin and Stephen. They're also somewhere in the room. Then the other thing we are doing is the complementary. Yes, the complementary frameworks. The way surveillance is done is what we need to improve. So we assume that probably after every patient has been assessed, there's a way of pushing the reports back to the Ministry of Health. So we want to have the automated diagnosis be a part of this entire process, in that by the time analysis is done with the application, it can be received back at the ministry to aid in near real-time surveillance across the country. So the goal is to have many of our tools deployed across the country, even the remote parts of the country. And as they're using these tools to do diagnosis in real time, also results are laid back to the ministry. So we'd have like heat maps of where maybe disease prevalence is across the country. So this is work that is being done to support whatever the ministry is doing in making sure that surveillance is done across the country for the different diseases that we are looking at. Then we're also doing report generation. So for all the diseases that I've looked at, TB, malaria, and cervical cancer, we want to be able to automate report generation. Each time pathologists or microscopists look at the blood smears and they are required to write a report, we want to be able to automatically generate this. So this work that's already ongoing. So what you see, that's sample 69. You see the actual report, and then you can see the generated report. And you can see that the model is able to pick out key observations that were made by the expert. But this was trained on a very limited data set. So as we keep on improving the numbers in our data set, we are near perfection in terms of being able to generate reports from the blood smears that we used for the model training. All right, so all this that we are doing is to try and make sure that experts don't spend so much time in analyzing these images, and then also for the patients to be able to get the results in real time. And we are also making these data sets available to other researchers. So we've done a couple of data sets. We have data sets for malaria, we have for cervical cancer, we have for cervical cancer, we have biopsy, and also pap smear. So anyone there that is interested in building models, please do visit our website for more of these data sets. Thank you so much.
Thank you once again, Solomon, for that wonderful presentation. We appreciate you. Let's just give him an AI clap. How does AI clap? Okay, interesting. Thank you very much, Solomon. I've been looking around and I was wondering if AI in health, of course I know it's going to reduce the time of diagnosis. Is it going to reduce the time of waiting? The waiting rooms are full, man. Is it going to reduce that? Maybe it's something we can ponder as we go along this journey. So right now, allow me introduce our wonderful Dr. Rose Nakasi to give us her remarks. Dr. Rose is an accomplished AI research scientist and a lecturer at Makerere University, where she serves as the head of Makerere Artificial Intelligence Health Lab. She's at the forefront of health technology innovation, leading groundbreaking projects. As I mentioned earlier, she has represented us in many aspects since our launch on 30th of May this year, and we are looking forward to many more of these aspects as we improve our health sector through innovation. Please, Dr. Rose.
Good morning, everyone. Happy to have everyone here. Honestly speaking, this has always been my dream, to have a room where different practitioners, different stakeholders who are passionately keen about solving the different health challenges that we face in our context, and that is in Africa, meet like the way we're meeting right now. So to me, this is a dream come true, and I know the conversations are just beginning. Protocol observed. I want to recognize the presence of Professor Buyinza in his capacity as the Vice Chancellor, Makerere University, but at the same time, DVC Academic Affairs. Professor, we're very much honored to have you here. In the same regard, I want to also recognize the presence of our college principal, Professor Tony Oyana. We are so much privileged to have you. The Dean, School of ICT, Dr. Joseph Balikudembe, who also serves as my boss. We are very much honored to have the representation from Makerere University. But with us here is a room full of different practitioners, and without them we wouldn't have this conference. I want to recognize the presence of the Ministry of Health. I've seen Solomon, but I know that other representatives are also coming. We are so much happy to have representation from the Ministry of Health, because at the end of the day, whatever we're doing actually goes back to you as our main consumers. The Ministry of ICT and National Guidance is also well represented. We have the GIC. They also are here, very well represented, and we've partnered with all those different organizations in organizing this conference. The different stakeholders from the diverse sectors, from healthcare professionals, AI researchers, academia, policymakers, industry leaders, all gathered in this room. Different universities, we are so much happy to have you join us in this conversation. Thank you for joining us, and you are all welcome. Once again, I'm Rose Nakasi from the Makerere Artificial Intelligence Health Lab, and that is from the College of Computing and Information Sciences, Makerere University. We are talking about a gathering that is specifically talking about a very pertinent topic, that is of artificial intelligence in healthcare, not just in healthcare, but across Africa. And I know that we have very many different representatives across Africa, and those who have joined us and are joining us currently online, to come together and discuss on how we can be able to harness and utilize artificial intelligence in healthcare more so in Africa. With the theme on building a strong ecosystem for an African health, and that is from research to policy and practice. So the bigger question is, why are we talking about artificial intelligence in healthcare, but in Africa specifically? The thing is, and that is the conversation we were having earlier on with Dr. Roth in the morning, that we've seen different applications come out of the digital health initiatives. But the missing link in most of these is that, do we have an ecosystem? Is it robust enough, especially in the African context? Where are we integrating research from academia? Where are we integrating policy? Where are we having a community engagement? Because these are the people who are going, at the end of the day, be impacted by the solutions that we're developing. Are we also looking at the practical aspects that come from research so that we make them impactful at the end of the day and are useful, not just seated somewhere in the labs? And then there we assume that we shall have impactful yet ethical, but again sustainable solutions at the end of the day that are able to impact the communities that we come from. So therefore, as part of this conference, we want to have a holistic approach, not just from academia, but from all the different stakeholders, that we can engage and come up with this approach where technological advancements are being appreciated, but they have to be aligned, and I think that should be very much underlined. Are we trying to address whatever solutions we're coming up with the health priorities in our different jurisdictions? Could be in Uganda, could be in West Africa. What are those priorities that are very pressing, especially in the health domain, that we need to address? And I think that is where research should be directed. Most of the times we've seen research coming up with very nice outputs, but at the end of the day, we don't have, an ecosystem where these are going to be harnessed. So I think through this dialogue that we're having today, we need to think, and I'm glad that Ministry of Health is here with us. Can we be able to think about solutions that are technologically driven, and to that end, artificial intelligence, to be able to support the different health priorities in our country? We've seen outbreaks, mpox, and I think that takes us back to the next link. So our commitment, therefore, and I know that the health standards always stress this out, that our main stakeholder is the patient. So therefore, as we think about this, what is our commitment to the underserved communities that we intend to impact? There are so many problems. There are so many problems around enhancing quality diagnostics, and I know that Solomon has done justice to give us ground for that. Combating drug resistance, we've seen cases where people take malaria treatment, but after some time they don't respond to it. How can we use this platform to be able to combat some of those health challenges? We've seen challenges where we don't have saving lives through early interventions. For example, the mpox that we've just had. What are the interventions that we need to look at so that we're able to save our populations early in time? But again, as we look at our main stakeholder, who is the patient, we have on the other hand the healthcare professionals who are working tirelessly. But again, one of the limitations, especially in the African context, is that they are very few. So how are we harnessing the power of technology, one, to be able to provide better patient outcomes to a patient who is our major stakeholder, but also the attending, who is the healthcare practitioner? So as we think through, again, that aligns with the healthcare priorities within our different context. So coming back to Africa, Africa presents a very unique opportunity, and I know that Eugene in the morning talked about this. How is Africa positioned? One, to be able to benefit from these new technological advancements, especially in healthcare, but again, appreciating the context where we come from. We know that Africa is a very growing population, and I know that especially the people in industry know this, and this is something that we need to take advantage of, and I'm glad we also have private practitioners in the house. So there is a very growing population, and that then presents, one, a challenge, but also on the other hand, it also presents an opportunity. So how can we be able to leverage on our uniqueness as Africa to be able to use artificial intelligence to solve some of those contextualized challenges while harnessing on the power of capabilities and opportunities that presents us with. And I know through the different engagements that we're going to have today, this will be tackled in detail. So therefore, this is a call for us through this dialogue to be able to look at our uniqueness and then position ourselves to develop solutions that are tailored to the rich kind of ecosystem that we have, the data sets, the innovative spirit of young people, the expanding digital infrastructure, so that we are able to utilize the capabilities that come with artificial intelligence. So as we go through the day, we are going to look at key themes that are going to address all these different things that we've talked about. And I think this is very comprehensive, because we shall be looking at how are we going to advance artificial intelligence research in health. We have seen some use cases that have been presented by Solomon. We are going to be looking at policy frameworks, because again, like we said, we can't be able to come up with all these different solutions, but without an enabling environment. So can we be able to also have a dialogue where we're talking about the policies that are going to align with the work that we're doing, so that whatever we produce is consumable, but again, in the rightful way. So the idea is, can we be able to also bridge the gap between research and practice? There has always been that gap. I know that people who have gone out, there's always been that platform whereby, especially the researchers at graduate level, they always are aligned with industry. But that is something that we lack here. And I know this is a call up for us in academia to be able to align the research that we're doing in academia with that is going to be impactful at the end of the day. So through this dialogue, again, we are going to be able to expand this conversation, and we find a way on how we can be able to actually bridge that gap, so that whatever is produced in the different research hubs or different academia institutions is actually reaching out to impact the different communities. And that again comes back to capacity building. If we're talking about artificial intelligence in health, these are multidisciplinary areas. We are talking about artificial intelligence, which is a computer science, but also on the other end, we are talking about health, which is also another domain. So how are we building capacity to have that interdisciplinarity coming together, coming up with solutions that are going to be impactful? And that again comes back to skill, because artificial intelligence is a skill. So how can we build capacity to have these skills developed to impact the healthy sector at the end of the day? And then again, this comes back to the cross-sector collaboration, because we live in a multi kind of environment where we're looking at scientists on one end, healthy practitioners on the other, but that is not just the circle, because we have all other, a bubble of so many things to consider. We have policymakers, we have communities. Bring all these and bridge this gap through our different professionals, so that we are able to build an ecosystem across board, and it doesn't just stop actually at country level, but across Africa as we bridge the healthy gaps that we are having. But again, as we look at the context in Africa, we have to be cognizant and appreciate the different challenges that this comes with. For us who have been in some of the experiences, we don't just talk about the good things that come out, or the good running model at the end of the day that is running, but there are challenges in there that we need to address. It is still a growing conversation, and I know every challenge is a stepping stone to a better solution. So appreciating challenges as they come in, from data to the infrastructure. Some places don't have internet, and probably if you want to send an image for an inference, it's not there. So how can we leverage that ecosystem that we live in, appreciate it as a challenge, but also work around it, so that at the end of the day, it's not just a limitation, but something to trigger our innovation further. We're thinking about ethical consideration, because we are in a very critical sector, which is health. Comes with a lot that whatever mistake is done, the impact is on the patient or the person, and sometimes it actually leads to loss of health. So what are the ethical considerations that we're thinking about? Can we be able to discuss them and think more into them, so that whatever research that we're doing, much as it's in artificial intelligence, but if it's going to be applicable in the healthcare system, how are we thinking about it in the bigger picture? And I know conversations around that will again be sparked off in this dialogue. Again, as we produce all these amazing solutions, what is the sustainability plan? How are we going to sustain them? Because of course we have this conference, it's just the beginning of it, but how are we going to sustain, first of all, the conversations around this topic, but again, the sustainability of the solutions, so that we are able to see a long-term impact come out of the pieces that we develop through these strategies. So, and that comes back, scaling and sustainability is about resources. So how are we going to even think about generation of resources? I don't know whether, Solomon, you have a budget for us to think about, and then we are comfortable. Yeah, but all those, I think we really need to have a very critical conversation around them, so that we are able to sustainably come up with solutions that are going to be impactful in the long run. And we're going to be able to look at that all through policy and regulations. And that again goes back to the enabling environment, really. Whatever we produce, is it going to be accepted? But even if it's accepted, is it accepted in the right way? So we need to think about policies and regulations, and how these are going to play a very big role in the adoption of the solutions that we develop. Because you can produce a very good solution, but at the end of the day, if there is no policy, if there is no regulation around it, it will just go to waste. So this is a very critical component that I think that we need to discuss, especially in this dialogue, at different scales, at country level, at the African context, so that we bring it out very clearly. Sure. I don't know, this stopped. So what is my call to action as I end my opening remark? How are we to sustain, and how are we going to realize the fruits of this conference? One, we want to look at it as an inspiration to people who are, in all our different sectors. How are we going to harness these conversations out of this conference to act as an inspiration, but as well as a momentum to where we need to look at? Can we leverage this conference as a platform for inspiration and actionable collaborations? Because I know that we all people from different sects, and I know that this is a very good ground for us to network, to collaborate, and see avenues on where we can be able to synergize on each other's efforts to come up with better and actionable solutions for health. And this is not just within this house, but across Africa and beyond. We want to look at this, therefore, as a call for collaboration, where we're going to foster partnerships that bridge research, policy, and implementation gaps. So then that just doesn't end at AI practitioners or health practitioners, but across the different stakeholders that are here, in terms of policy, in terms of research, in terms of implementation gaps that we need to bridge. But also looking forward, we just need to be optimistic. That of course we've had some level of evidence that artificial intelligence can work in health. So that is just the beginning of it. At least there is hope, there is evidence. So can we be optimistic that this is just the beginning, that we need to now build on top to know that there is already a potential for leveraging artificial intelligence in addressing Africa's healthcare challenges. There are so many challenges. It's not just in diagnosis. Everywhere you look, we all have had a given healthy challenge at one point in time. So how can we then think about the capabilities that come with artificial intelligence so that we can harness whatever capability comes from it to be able to solve any given pressing health challenge? And therefore, we want to think about this as a forum where we're starting from to have a forum of AI in health in Africa. This is just a beginning platform that we can be able to build upon to extend the conversations, not just in one day, but to have it as a forum that we are going to leverage on to commit to driving progress beyond the conference through the continued dialogue, partnerships, and innovation. I thank you.
Let's give another round of applause, please. Thank you very much, Dr. Rose. She's our current lead at the AI Health Lab in Makerere University under the College of Computing. So we are very grateful for what she has talked about, and the call to action is to all of us on how we can actually enhance and work this thing. Like I said before, this is going to be a multi-pronged approach. We have to be in a position to come from the health sector, and it's just a beauty. I've seen from our listing, we have people from WHO, GIZ, universities, all representing. We have people from Gulu. I saw somebody from Pachido in Gulu, and that's just interesting. So I think we shall have a very interesting discussion going forward with this kind of approach. Right now, I would like to take this opportunity to welcome our principal, and who in turn will, after I leave the stage, he will also do the honors to also welcome our Vice Chancellor, and our Vice Chancellor will also do the honors to welcome the Ministry of Health. Professor Tony Oyana is the Principal, College of Computing and Information Sciences and in Makerere University, and he holds a PhD in geography with concentration in geographical information systems from the State University of New York, Buffalo. He has previously served as a director of undergraduate programs, Department of Geography and Environmental Science Resources, Southern Illinois University, and as a director of informatics for the Institute of Research, Innovation, Synergy, and Health Equity, Community and Collaboration Core, University of Tennessee, Health Science Center, Memphis, both in the US. His research interests are in GIS and GIS science, visualization and cartography, spatial epidemiology, applying GIS techniques to subfields of disease, surveillance and monitoring, bioterrorism, environmental health and exposure, spatial epidemiology, multivariate statistics, and spatial statistics. With this, I welcome you, Professor.
A very good morning. As you have heard, he has been very generous with my past. I am humbled to be here, to be part of this story and journey. Okay? I wish to welcome all those who are coming outside of Makerere. because I know that when we fertilize academia and other areas, we are able to offer more optimum what? Solutions. I know sometimes Makerere is beaten so hard. They say that we sit in our silos and aim to publish. Yes, that is our primary goal. If you don't publish, you perish, okay? Academia depends on science, so we have to perform that task. But we're also very good at engaging other stakeholders. I want to recognize my friend, colleague, Professor Buyinza. He's currently my boss because he's representing the VC. And he's still my boss because he's the Deputy Vice Chancellor for Academic Affairs and our academic registrar at Makerere University. So he holds all those responsibilities. The deans, both the deans for the college are here, the dean for the School of Computing and the East African Library and Information Science. You may want to stand up so that people see you when they come to either help with the activities that we do at the university, but many times graduation is coming. You see, when you are teaching and doing your research, the community only knows during the graduation period when their daughters and sons don't appear on the graduation list. Actually, the week leading to graduation, sometimes even get calls from very high-ranking government officials. What is going on? My name of my daughter or son is not what? Appearing. So then become very visible and important to the function. So those are very important people. I want to thank Dr. Rose Dakasi. I have known her for a while. And sometimes when I know you over a period of time, we become a first name what? Basis. Even me, I don't like this. I know our parents liked the titles. Idi Amin was one of them. But I am fine with Tony, okay? If you have known me for a while. I don't really crave to be professor, doctor, you know. Sometimes in Europe it is professor and doctor, okay? America is just doctor or Yana, even if you're a professor. So I want to be very grateful for this opportunity and to address you on a topic that I was given. But the pace has been set, okay, by the first speaker, Solomon. I always call Solomon the wise man in the Bible. Okay, Solomon was very important in God's journey. And you can see he gave a lot of wisdom at the beginning about the overview of the conference. And Dr. Rose Nakasi. My title of my conversation was to leverage resources, talent, and research infrastructure to address pressing health challenges. And I will try to attempt to respond to that title. A while back when I did cognitive science and philosophy, I was told that when you are responding to something, you must understand the question, otherwise you misfire, okay? So the key things, what resources? You know, the resources is a broad word. It even includes the talent and the research infrastructure. So what are those resources? May I think that the College of Computing and Information Science has incredible talent. I actually think out of the 3,000 plus students we have talent among the 10%. And I can actually address them as the top brains in the country, the top 10%. So 300 students are really good, okay? And sometimes employers don't want to absorb our students. They say, no. They are not ready. But you disallow people to grow, okay? finishing a degree does not mean you stop growing. Even for me, who's a professor, I'm still growing. Okay? You never stop to grow until you are buried. So your knowledge continues to evolve with the time. Okay? I think the right thing to say is, how do we upskill? Okay? Singapore used that word. How do we upskill? And they had an excellent upskilling program. When you get out of university, they still can upskill you so that you're ready. Okay? I think in Uganda we should design programs where we do some upskilling in terms of knowledge and the areas where these candidates are going to work. Okay? Because already you have a basis, they have a degree. You can just upskill them. So the conversation should be, how do we upskill? But also, we need to identify talent. I think we are not very good at identifying talent. We need to learn how to identify talent. In the US, where I've lived for over 20 years, actually they start in middle school to identify the very good people, so that they know their pipeline. By the time you get into the university, there's already a database of that talent. In Uganda, do we have that database? Okay? At Makerere, what I do, in my college, I look at the top students who are scoring well in exams, and I try to see a way of getting to know them. Okay? That's one way. But you're only using scores to identify what? Talent. Sometimes there's hidden what? Talent. Hidden talent needs to be discovered and nurtured and offered opportunities. The next thing, the infrastructure. I think Dr. Rose Nakasi hinted on key things. On the data, the infrastructure, the ethical, sustainability, and scalable policy and regulations. Those are the challenges, healthcare challenges, okay, that we need to also focus on. So if we have the health, the research infrastructure, if it is data, are we able to store the data we generate? The phone here, every second is producing data. But it's my provider, Airtel, who keeps that data. What do they do with it? Mainly business. They want to expand their market. But do we have access to that data? In the US, they can tell there is a cold in the country, but they look at the data and say, people are talking about a cold or going to the clinic. As they tweet, they can identify certain emergencies. So that can be used to help identify the status of things in the country. So we have to look beyond the data that is produced and the value that that data can provide. I know New York City uses the data. If there's a certain threshold of students who are not going to school, they're able to tell an outbreak also. Just by looking at who has come to school. If the number is big, they say, maybe there's an outbreak. Let's dig deeper. Okay? So, my argument is, do we have the big data infrastructure in the country? Is it well tapped? Is it used well? One of the interesting things I've observed as an academic, that elections make us crazy, and I know 2025 is coming, 2026. They use a lot of data to track sentiments, okay? But we can also use the same data to solve and aim at everyday challenges like health. Okay? So it is vital to remember to use both real time, okay, that's one that is being produced every hour, every minute, every second, and archived data. If it is TB, in the last 10 years, which areas are emerging as potential threats to the country? TB is actually, even if they say we want to eradicate it, is one of the emerging diseases. When I was growing up, TB was very rare, but now, almost in every referral hospital, there are TB what? Cases. We have actually been looking at the data so we can afford to say TB is there. Pneumonia is another thing that is also emerging, okay, among young children and adults, okay? So are we watching those emerging diseases carefully from the hospital data archives? But the quality of data also determines. When you take government data, even UBOS, the other time I know they had to come out after issuing their census data, and they had issues. Now, people beat up UBOS a lot, I can say. But 10% of collected data normally has uncertainty, okay? So don't beat up UBOS. You can challenge them to improve quality, but they gave you an entry point, okay? The quality of data is actually improved over time. Sometimes there are techniques that you can use real time to improve the quality of data. And there are also techniques that have been developed in statistics that can help you improve the data what? Quality. Okay? Let me give you an example where we have issues. I am currently unemployed, for example. You give me a phone call and say, are you unemployed? I answer, yes, I'm unemployed. But after I put down that phone call, I get a call telling me, you have a job. So 1 minute earlier, I was unemployed. 1 minute after, I am now employed. It's the same thing with the birth and death. I am now alive. A minute later, I may be dead. So uncertainty does there come bias, and even telling those enumerators who are going to the field that can't count a household. You may think a household is very easy to count, but in some homes, there are about 6 households. So you reach, you say, we live with my uncle, with my auntie. Are they part of that family? So we need to conceptualize that, okay? And that can bring errors, okay? So those sources of errors do happen. So if you're well read in error and uncertainty, you don't beat up your boss so hard. You are careful with your comments, okay? But we have made very good advances, even diagnosis. And the work that Dr. Rose Nakasi is leading is improving what? Diagnosis. If you talk to doctors, one of the challenges they have is diagnosis, misdiagnosis. Okay? You have to go to the clinic 3-4 times before they identify what is happening to you. Some people even have to travel. We Africans, normally when the diagnosis is a problem, we say bakuloga, that somebody is bewitching you. They even try the traditional doctors. And they also still do what? Misdiagnosis. Okay? Yet it means that treatment and care can be better handled. Now, this research is at diagnosis level, but still there are opportunities in treatment and care. We still have issues also with the treatment. Sometimes treatment is also bad. okay, as a challenge and the care. In artificial intelligence, novel methods in machine learning, deep learning, big data methods, and enhanced analytical techniques have shown promise in advancing science and technology and also helping us create innovations. The other day I was reading a paper that, the daily paper, that they had stolen some money from Bank of Uganda. Today they say they have recovered the money. Somebody somewhere can sit on their computer somewhere in the world and disorganize Bank of Uganda. The same thing, somebody somewhere can disorganize your diagnosis. So do we have enough cybersecurity that when I'm transmitting this data from the phone to the doctor, the information remains the same? We are very vulnerable. Okay? If somebody stole your information, they can steal your identity. And healthcare is very personal. If your neighbor stole your information and he says, Professor Boyes, I think he has been sick. We are going to take his land. I just got a report. Will you be happy? So when you have these tools, we have to be very careful. Okay? So cybersecurity also becomes important security measures so that this information that we are storing is reliable and trustworthy. And then ethics. One time I was in South Korea. We're in China. When you fly into China, the image is quickly taken and run into the database. So we went to a nearby police station, and they could produce all your information and where you have been to because they have a lot of surveillance cameras. Okay? But we were surprised when we went to another lab. We wanted it to identify our ethnicity and my gender. Okay? That time I was with Dr. Swipe. First, it could not identify me as a black man. You see, there are issues with accuracy. I'm a black man because there's not enough data samples for this technology. It does a very good job to identify a Chinese and the gender, but does a bad job in identifying. So, can we trust the models? Okay? So it is not automatic. We have to be very careful and also question the results. So please, AI must be what? Questioned. It doesn't mean because it's automatic, it is correct. Okay? That is important. Find ways of dealing with emerging diseases, especially infectious diseases. Design low cost. And I normally challenge the AI lab and my friend, Dr. Ernest. For the last 20 years in the AI, they have been seeing computer vision. And even when I travel and other professors come from South Korea, they say, but you people need to move on to do other areas. Yes, we are very good in computer vision, okay? And even at some point when Rose Nakasi was applying for the grant, we need to develop more powerful deep learning techniques in the lab and move away from computer vision. Computer vision has served us well, but is at the lower end of AI. So we should be engaging more powerful AI approaches. Okay? And recently I was looking at, there's a program on BBC that comes every Saturday For the first time, a robot was doing operation, transplanting an organ. Just robots, nobody. Okay? Robotics is being combined with AI together to develop more advanced devices and knowledge. We need to be in that area. We should not leave MIT and Harvard to comfortably sit in advanced areas and we are spectators. So I challenge scholars in Africa, especially the young people. Solomon, I know you love computer vision, but you're still young. You need to move into deep learning and more powerful areas, especially combining AI and robots is a very hot area. Okay? We should have a robot addressing us on new knowledge instead of a human being. Wouldn't that be fun? It will have a lot of knowledge and can tell us a few things. There are some things that I've identified here that need some thinking. They include the following. Data quality during acquisition. We still have issues with data quality when we acquire the information. Okay? Harmonization is still an issue that requires good thinking. Devices between Apple to Android to other systems. In Uganda, when you're in the third world, you receive a lot of aid from China, from Russia, from America. Sometimes these devices are not talking to one another. We get a lot of modern laboratory equipment, and after 2-3 years, it cannot work with another equipment. Okay? So that is still a challenge. We have big challenges with storage. Okay? A lot of data is destroyed every day because we don't have real-time data storage systems in the country. They are very expensive. I understand ICT is here, but our capacity is still limited. Okay? So we need to have data storage improved upon. Enhanced methodologies. I know they were showing us information at video level. The dean was asking me, how about aggregation? When you aggregate these methods, what do they show us? Okay? Because generalization is a good thing in science. Okay? We want to create tools and services that facilitate research, and you're doing some of that. We want also to promote education. Our young people must be smarter than us. Okay? First of all, they are good in IT, but we need to introduce programming early on in primary schools. Not to hit the university, that's when you do your first programming. You should start in nursery. In China, actually, the kids start in nursery to program. Okay? So, Dr. Rose Nakasi, do your children program? You are doing these things and writing programs, but have you introduced your children to program? And most of the work is happening at the point of care. I want to go to a point of care, and I'm told, Tony, you have malaria. Then I seek what? Treatment. So this real diagnosis that we are talking about should happen at the point of what? Of care, to improve diagnosis. As I wind up, I want to challenge us, physicians, decision makers, and other professions, that our main task is to ensure that we improve health outcomes. We need better health outcomes in the country. Okay? We should not, our grandparents never let us down by getting independence. So the expectations are very high. They should not come to Mlago at their age and not get the right diagnosis and treatment. Okay? We can leverage information technology to improve patient care and population health while lowering healthcare costs. We also have the opportunity to be transformative and disrupt. You know, there were stages of development, but now you can leapfrog. I actually have seen science and technology innovations that will hope, if we go according to their plan, fast track Uganda to be like the Asian giants, okay? So I think that we have the opportunity to accelerate our development, to accelerate our healthcare, diagnosis and treatment, and I do thank you for the opportunity, Dr. Rose. At this juncture, before I sit, I would like to invite my boss, the VC, my friend. I have to put in my friend so that I bring you closer. Professor Buyinza to address us. Thank you very much.
My colleague, Professor Tonoyana, the principal, representatives from the Ministry of Development Partners, my friends in university administration, collaborators, but most importantly, I need to spell out that they are representatives from sister departments and units in the university. I've seen in One Health Approach. I've seen Dr. Mren from COVAB. Thank you for believing in this agenda that is being spearheaded by COSIS. Good morning to you, colleagues. Greetings from the Vice Chancellor, Professor Barnabas Nawangwe, who is unable to be with you, but he supports the vision of the conference and the agenda that you've set out to achieve. When you are representing a Vice Chancellor, you need to be very careful. You just have to keep formal and read the text. So it makes my work pretty easy. I've been introduced. It is really indeed with great pride that the Vice Chancellor welcomes you to this inaugural Artificial Intelligence in Africa Health Conference hosted by the College of Computing and Information Science and Makerere in general. But specifically, we want to thank the AI Health Lab for taking this initiative. The gathering of brilliant minds here today from fields of academia, healthcare, industry, government is testimony of the transformative power of collaboration in addressing a common challenge like our health concerns today. The Vice Chancellor wishes to extend heartfelt gratitude to the organizers. I've already mentioned Dr. Rose Nakasi, and our esteemed partners and participants who have joined us today and have gladly accepted to share their insights and also participate in shaping the future of artificial intelligence in healthcare systems in this country. At Makerere University, as many of you are aware, we pride ourselves, and indeed we are guided by the singular vision of being a thought leader in transforming Africa through innovations. And this is exactly one of those. We believe that over the years, we have refined our strategic focus to align ourselves with the vision of not only the continent, but the global agenda that prioritizes health, climate resilience, agriculture, education, and the other topical priority areas. Our strategy recognizes that technological advancement is central to societal transformation. I always share with many colleagues that Makerere, how many of you understand this terminology or nomenclature, University 5.0? You understand it? Okay, you do a Google, Makerere, we want to be a University 5.0. When people are talking about the fourth industrial revolution, we should be really ahead of that. Let's be a university of the future. And whatever we do, when you look at our strategic plan, is really to shape ourselves and fit into that University 5.0. Because we believe that it's only then that we shall transform ourselves and participate in the digital global world of work. And this is exactly what Rose is inviting us to do. I know for sure we've talked about artificial intelligence in detail, and we are to discuss this in course of the day. But I know for sure that we are, as a university, we are investing in cutting-edge research, strengthening collaborations, fostering interdisciplinary partnerships to solve real-life challenges, and therefore establishing the AI Health Lab is one of such milestones that represents our commitment to harness the emerging technologies to improve our communities and improve lives in society. I know for sure that when Dr. Rose Nakasi was presenting here, I got a perception, and I believe many Ugandans believe, like the way I do, that AI should remain, and we should perceive it as a signal reader, a signal translator. It should not at any one time, okay, replace the human intelligence. Exactly, even Professor Yana alluded to that. Okay, so if we take it that this AI is going to help us in translating patterns from data sets, then it means we must remain relevant and critical in the health care system. I know for sure that we want to use it to build effective and trusted AI-augmented healthcare systems, as everybody really wishes to do. But then, as we do that, we need to be cognizant that the challenges still persist. The challenges of AI, Dr. Rose Nakasi has alluded to them. Issues of data quality and access, which Professor Yana alluded to, the technical infrastructure, organizational capacity, and above all, ethics and responsible practice, in addition to aspects of safety nets. That being the case, it means we still need the able guidance of experts like Rose. And allow me to thank you really for spearheading this agenda. At one time, I met Rose at an early age in her professional career. And I had a lot of doubts about her project. That time she was talking about using, is it a phone as, and other gadgets as a microscope and, to diagnose malaria, tuberculosis, and cancer and all that. And I was saying, wait a minute, isn't this utopian? What is she talking about? Because clearly, little did I know that she will grow to what she is today. I want to thank you for the resilience and also visionary leadership. Of course, your unwavering dedication in innovation and excellence has positioned us as a university as a global leader in artificial intelligence-driven healthcare research, and we thank you. I also want to extend my gratitude to our collaborators and sponsors. Okay, you might be aware that Google is enabling us to do this. The NIH and others that have through their generosity, supported Makerere in advancing our vision and mission in transformative artificial intelligence solutions. Of course, their commitment is instrumental in enabling us to fulfill our dream and mandate in generating knowledge, fostering innovations, and improving the lives of our communities. I would also like to thank, of course, most importantly, the government of the Republic of Uganda for supporting research and innovation. Dr. Sabrina, please convey our appreciation. I know you are a member of the Grant Management Committee of Makerere. This critical funding has allowed us to develop solutions that address the unique challenges of our society, from health, education, agriculture, to climate change. Such investment has demonstrated the government's commitment to its role in supporting research and also building the knowledge economy that we claim we really aspire to. Artificial intelligence, no doubt about it, is an emerging game changer. I know for sure. But its potential in healthcare is particularly transformative, though initiatives like the AI Health Lab, through these initiatives, we are creating solutions that will help us to solve the unique health challenges. For instance, we have deployed these powered diagnostic tools to tackle diseases such as malaria, as Rose will take us through, enable faster and more accurate disease detection. And in addition, I know for sure that beyond health, it is also helping us really to transform many sectors, including agricultural productivity through predictive weather prediction tools and supporting urban planning. And also, most importantly, it is a catalyst to societal transformation in general. Our successes are indeed a result of true partnership with many agencies in the government and outside. But however, as the vision, in fact, the theme of today is in tune with our vision. We want to build strong ecosystems for AI in African health systems, but also use AI, integrate AI in all Africa's development agenda. Colleagues of mine, let's remember that the ultimate goal of any innovation is to really serve society and humanity. Therefore, artificial intelligences do not only enhance efficiency, but most importantly, foster equity and inclusion and ensure that its benefits are felt by all, especially the most vulnerable parts of our society. Makerere University is committed to this vision, and we believe that we shall rally and also offer institutional support to your agenda of building impactful ecosystems that are ethical and also, of course, deriving sustainable solutions. We will continue to be a beacon of excellence, empowering you as researchers and communities through education, research, and innovation. But we cannot do this alone. We need the support of sister agencies, including ministries. And I've been informed that in the room we have an Assistant Commissioner, Mr. Paul Mbaka, representing the Minister of Health. Okay. We recognize that there are significant challenges related to, of course, the wider adoption and deployment of artificial intelligence, not only in this country, but also specifically in the healthcare system. But these challenges notwithstanding, we are resolute and committed to ensure that we shall build the capacity and overcome and, of course, tap into the benefits of AI in its totality. We believe AI will continue and also help us to amplify and augment, but rather not to really replace human intelligence, as I said at the beginning. Therefore, let's set off this journey. We're aware that we are building a strong ecosystem, but we must still be interested and also participate in all the stages of its progress. Of course, I know for sure that friends of mine, including Dr. Sabrina Chitaka here, tell me that despite more than over a decade of significant focus, the use and adoption of artificial intelligence in clinical practice remains limited. Therefore, we need to accelerate, we need to set the pace, and we need to track and see that we are getting optimal products and results. We should not remain at a design stage. Thank you very much. I want to now thank you for the dedication and commitment, and I want to wish you productive deliberations in the course of the day. And the Vice Chancellor says, continue being trusted and live partners as we build for the future. Thank you very much. According to program, okay, colleagues, it's now my singular honor and pleasure to invite the representative of the Minister of Health to address us, and this is none other than Mr. Paul Mbaka. You are sincerely welcome. Colleagues, join me to welcome the Assistant Commissioner. Thank you.
Good morning, colleagues. I take significant honor in being up here to represent the minister, but I'm happy that we are finally, as Africa, making significant considerations for AI. And I'm really hoping, and like a typical Ugandan young child would do, I am keeping my fingers crossed that this conference would act as a turning point for us to really accelerate our efforts towards leveraging artificial intelligence for health. Allow me to stand on the protocols that have already been recognized. I'm sure if I decided to read them out, I might miss out a level or two, and I don't want to cause discomfort. So allow me to just stand on the protocol that has already been established and go straight into it. A few years ago, conversation around artificial intelligence was something that we had relegated to the fringes, to a few science fiction enthusiasts. And at this time, serious talk of artificial intelligence was for academics and sometimes, like Prof had highlighted, it was also something that dreamers were making some considerations for. And very few people actually imagined that artificial intelligence would play such an important role in our lives as it does today. The very idea of making artificial intelligence relevant in our day-to-day lives, much less as an outward tool, such as ChatGPT, was not in the minds of actual practitioners. You know, all this, it always seemed like something that is vague and opaque, but not a tool that is actually applicable to your day-to-day life, that is based on this kind of technology, was unimaginable to many. Just the other day, I was using ChatGPT, and I wondered to myself that wouldn't it be nice if I could use natural language to request insights or statuses of projects, project implementation within our own health sector, which data we already have aggregated within our systems, in either reports or databases. But I never need to read a whole report. Wouldn't it be nice if I use something like ChatGPT to ask very specific questions about just a paragraph somewhere in one of these many reports, and I don't have to go through all of them to find out the specific one-line answer that I am looking for. I think there are opportunities for this here. And the problem with health is that we are usually in the back foot. In the financial sector, such tools are already available. Financial executives no longer have to use complex queries, rely on this or that technical officer that he has to call every once in a while. The technical officers would compile this data in places that are then that can then be mined by artificial intelligence tools and provide them insights. Today, AI in many facets of our lives, AI is in many facets of our lives. It has made great strides, particularly in healthcare. AI-based image analysis is being used in pathology and has helped with diagnosis of conditions such as breast cancer, among others. And Prof. Ably highlighted some of the diagnostic applications that you could possibly use in the cases of just deploying tools as simple as smartphones to do diagnosis for things like malaria. This is of particular interest in our context, where we have shortage of experts and and the world over, in health, AI is driving, is making significant strides in diagnosis and detection of disease, remote care, particularly telemedicine and virtual health assistance, predictive analytics, epidemic intelligence, optimization of resources and supply chains, augmenting medical training and skills building, personalizing medicine and treatment plans. Imagine the challenges we all currently have with intervention mixes. I can give you an example. So we all know that when you sleep under a mosquito net, it will contribute to malaria reduction to some extent. It will not prevent you from ever getting malaria, but it will contribute to a reduction. If you spray the walls in your house using what they call indoor residual spraying, it will also make a contribution. If you do environmental management and slash outside your house and so on, and throw away empty tins that mosquitoes might breed in and so on, it will also contribute to some extent. If you sensitize people and they are aware about malaria control interventions and so on, it will also contribute to some extent. But if you live in a resource-poor country like Uganda, and you don't have unlimited resources, and you cannot provide everyone nets, spray everyone's house, ensure that there is environmental management for every community, ensure that all your behavior change communication that you do towards malaria in regards to early treatment, ensuring people don't self-medicate and they diagnose before they treat and all these things, you cannot do it effectively. And you have a fixed pot of money. How can you optimize the deployment of these resources so that you can do just enough of each of them to maximize your impact? There's an opportunity for AI to help us there. And this is not in direct care, but it is in how we plan our resources. So that is something that we could also take advantage of. Those opportunities exist, but these are some of the areas that would really have outward impact. In Africa, AI is being actively used to address healthcare challenges, improve patient outcomes, and make medical services more accessible. We have adopted AI for medical image analysis, for example, diagnosis of cancer, TB, etc. Because actually, some of the devices that we currently use these days come already embedded with AI, but there are some of these proposed cutting-edge solutions like the one Prof was talking about, where we could also use mobile devices like phones in some of these hard-to-reach places. We're also providing what you call clinical decision support. Clinical decision support, remote consulting and triage, virtual health assistants, and chatbots. The problem with the interventions that we are doing currently is the scope and scale. They remain very limited, and to a large extent, I don't want to say in labs, but really for scholarly purposes. For scholarly purposes. We have not been able to transition some of these things that we're doing, like, for example, deployment of predictive analytics for disease outbreak detection, for example, real-time monitoring of patients and diseases, personalizing treatment, and management of chronic conditions, including monitoring of pregnant women, healthcare workforce training, given if you have data that is being generated and you can run some models over it, you can tell which of your healthcare workers have specific training needs, and you can customize trainings for them, other than boring them with things that they already know. You know, whenever I use the word boring, some Bazungu ask me whether I'm trying to make a hole in something. I think I'm supposed to say boring, but influence of mother tongue plays me all the time. So when you're training people, and you train people on things that they're already proficient in, you cannot command attention. So the question is, how do you tailor-make your training? Is there an opportunity there for AI based on practice, based on information that you can collect in a somewhat passive way to tailor-make trainings for different healthcare workers? But, like I said, we have deployed AI in small scales. We continue to face significant challenges. We have laws that we must abide by, and in some African countries, these laws don't even exist. Laws around data privacy and security are important. Laws around benefits that go to data owners if their data is to be used and commercialized. But we also have limitations in relation to computing power, in relation to supporting infrastructure that would enable our computing power. Talk about reliable power. Talk about just physical security. You know, Orange, there used to be an organization called Orange in Uganda. There was a telecom. I can talk about them comfortably because they are no longer in the country. The chances of being sued are limited. So when Orange was establishing, they hired an office on Clement Hill. And they hired an IT company to set up for them infrastructure, spent about 2 weeks, laid cables, local area networks, and then finally they came and deployed computing devices, client computing devices, computers, and so on, in the whole building. So this was just before they could open and employ patients. I used to work very close to them. That's how I know the story. So one Monday morning, as I'm walking to office, there is a bit of commotion around the office that was being established. And everyone was asleep who was around there. The security guards was sleeping. They had been drugged. Anyone who was around the building the previous night had been drugged, and they were all asleep. And the entire building had been emptied of all the computing devices. So Uganda still retains a significant problem related to physical security of computing devices, because these are highly priced devices. You can sell them easily. So if you decide that you would like to deploy AI to provide clinical decision support in Naguru Hospital, for example, you must be thinking also that if I give all these clinicians computers, will these computers be safe? It is not as trivial as I will bring the computers and we will be good. So issues around how we could secure these devices. If these devices are to be stolen, how do we ensure that the content inside, the privacy and protection with the content can be at least sustained if we cannot physically secure the devices? And then the issue of reliable electricity. So in the health sector in Uganda, we've started deploying computing devices just so that we can take advantage of things like artificial intelligence. One of the things that we've observed, now that you've provided a clinician a computer and he can only manage a patient through it, is that actually, even in Kampala, electricity supply is not constant. But while you're seated here and there's no there's no patient line in front of you, you don't realize that this power is flickering every 30 minutes, every 45 minutes, every hour. But it is significant when you have patients in front of you. And that calls for significant consideration when we are deploying AI-based tools. If you're going to provide decision support to a clinician, how do you make design considerations so that you can have reliable power, you can make sure that all connected equipment, you know, sometimes when we design networks, I like picking on infrastructure people because I'm not one of them. Like sometimes when we design networks, we can provide UPS for the client-facing computing device. But all the network switches and so on don't have backup power. So when there's a flicker, my computer is on, but somehow I can't access the server. And yet the server is also on. But the connection between us is no longer available. So there must be significant consideration for infrastructure as well. And I'm lucky I'm excited we are having this conversation with academia. Because training is an important role that we must consider. The problem with how we do training in Africa, and I don't want to talk about Kenya and Congo and South Sudan, but the problem with how we do training in Uganda, and you know, I always laugh at these conversations that people have when they say that, you know, we were taught these, there used to be that complicated mathematical formula we used to call the bulldozer for solving simultaneous equations. So Ugandans are complaining that I was taught this bulldozer and I have come to industry and I have found nowhere to use it. And actually, the problem with your inability to find where to solve simultaneous equations is your ability to cheat your employer. There is an expectation that you bring your expertise to the workplace. The problem with how we do training is that we expect training to stop on the day you receive your award. Actually, training is expected to be generic so that you can be deployed in multiple areas. The completion of training is supposed to happen within the industry. The problem we have is that we get all these graduates and then we pick tools from the global north and the west and tell you, just use. The question I always ask myself, Dr. Peter here is graduating computer scientists annually. What are they going to do if we continue relying significantly on tools that create jobs in the US? So the ones that we graduate here, who will create jobs for them? So you come out of school, a lot of these things like AI and computer science are knowledge-based areas of work. If you don't practice, you need a year or two to become completely uneducated. Things that you learned. Are you going to start tweeting that I was taught optimization in class, and when I came to the workplace, I found that no one needed to optimize anything? So we need to change our mindset fundamentally if we're, first of all, to take advantage of the talent that we have available, people who can innovators picking innovations that were working in the US and in China and just trying to superimpose them. So one day we went and collect, and this was I think it was an AI-based tool actually, that was using proximity to determine contacts. So one day we went and collected a bunch of people who seemed to be a contact of a possible COVID case. And you know what we found out? These were neighbors who are just one wall apart. But the GPS tool just put them next to each other because one was on this side of the wall and one was on the other side of the wall. So we rounded up people who were not physical contacts of each other. But it is because we were using a context that was not ours. We were not innovating for ourselves. We were using an innovation to find a problem that we can apply it to. Now, these fundamental philosophical changes in terms of how we design the tools are important for us. And this is one of the reasons why we have limited investments in terms of enabling some of the digital tools that we have, because the design considerations are insufficient. So when you come to industry, we struggle to find applicable mechanisms to apply them. The last challenge that we have is validation. The problem that we're currently having with the innovators around artificial intelligence is that they think that if you design a medical device that is based on artificial intelligence, the people who should validate it should be people with IT background. Now, the Ministry of Health has a mechanism, for example, to validate thermometers. This method is neutral of technology. If you make a thermometer that uses mercury expansion, someone else makes a thermometer using infrared, all of them are subjected to the same evaluation without diving into which technology is in there. Like, no. So you brought us a technology, can it measure temperature accurately? The problem with a lot of the medical devices that we have so far innovated on that use artificial intelligence, talk about the diagnostic tools and so on, we do not want them to go through the same rigor that we are currently using, for example, to use the same diagnostic tools that are doing that same level of diagnosis. Let's take an example of a malaria test that is based on AI. If you develop a rapid diagnostic test now, it will be compared without thinking too much about the science in the test strip. It will be compared with the gold standard. Computations on sensitivity, specificity will be done, and a decision will be made on if this is unacceptable, is a device that you could accept. The question is, these tools we are developing based on AI, have we submitted them? Have we submitted them to those that validate to get this same level of validation? In the US, where they're using a lot of image analysis, and for us, we're just transposing the devices that are approved by the American Food and Drug Authority. We just transpose them and bring them here. But all these medical devices that use artificial intelligence that are being applied in the US go through some validation by the Food and Drug Authority. The same ones that are validating other methods that you would use, including whether you're using a telescope and the likes. So we need to surmount this hill and start following the appropriate processes. If we don't, we shall remain in the lab and we wonder why these things that we are doing cannot be moved to the industry. We have to know that there are these processes for validation, which are intended for protection of the general public, that we must go through if we have to move out of the laboratory. But as we go into these things and as we make consideration for those challenges, it is important that there is protection of intellectual property, individual privacy, ensuring ethical and responsible use of AI, and bridging the digital divide. It shouldn't be lost to us that innovation will always be ahead of legislation. And there is a very good practice that we should benchmark. Was it last year? The US Senate, it invited people who are experts in tech. And they were, I mean, you know, sometimes people do not want to look like they don't know. So they packaged the thing very nicely. But what they were basically trying to do was can these tech people give us information that can facilitate us in terms of coming up with progressive laws, guidelines, and policies. This is what they were really trying to achieve. Because if you allow legislators to legislate for you without sufficient expertise, the legislation can be those that are not progressive. They would instead take you back. So there are these innovations that we need to take advantage of. These AI, we need to take advantage of AI to help us progress. But we must legislate in such a way that itself. It is ever evolving with speed and in scale. Africa will have to develop thoughtful and innovative approaches to policies that protect their citizens while nurturing the flexibility and economic potential that makes AI such a compelling technology. Governments should apply a light hand on regulation, not to kill creativity in the AI space. Include speed in the building of health sector digital public infrastructure that will make it possible to bring the benefits of artificial intelligence to more people. This could include deepening of internet penetration, carefully considered deregulation where necessary, as well as strengthening and enforcing intellectual property rights. AI can have the broadest and can have positive impact on the health sector and on the largest possible number of people in Africa, most especially because of some of the challenges that we face, particularly around shortages of experts. However, it comes with some challenges that I must emphasize are worth facing. These challenges that come with AI, I must emphasize that are worth facing. We shouldn't fear that because of these challenges, we should run away. And we must also take note that a lot of the challenges that we are facing with AI have been challenges that have been faced whenever human race has experienced any very disruptive technology, whether you are talking about the light bulb, whether you're talking about the automobile, whether you're talking about the internet itself, the same level of impact and disruption and the requirement for reorganization. And if we don't adjust in good time, the dividend that comes with artificial intelligence will be lost on us. Thank you very much. I'm supposed to say that allow me to declare this conference open. Thank you.
All right, let's just give a round of applause to everybody in the morning session: Solomon, Dr. Rose, Professor Tony, Professor Buyinza, and Mr. Paul. Just a round of applause, please. Thank you all for being patient. I know we need to go somewhere, but we just need to do a little bit of housekeeping. First and foremost, as you're going in for the break, please ensure you pass by the behind table and pick your tag. Daphne, are we having it here or outside? Okay, so I'm going to be calling a couple of people. They come onto the stage, and then we have some photos. And this is going to be the order. We are going to have a photo from the guest of honor, that is the Ministry of Health. Will please, as I just come on, Professor Buyinza, Professor Tony, just join us on the stage. And then I'm going to call some people who will be joining these particular persons on board. They'll remain, Dr. Rose, please join us also. So they will remain the constant, but others will be changing. So may I have people from academia join this? When I say academia, I think everybody's gonna come on the stage. Okay, I know we have people that are practicing main there, so that we have people that are coming from other sectors, from different universities. If you're from Makerere, if you're from Cavendish, Ecurie, just a moment, we're finishing with them, but they'll remain constant. Let's also have quick transition, because their legs are gonna get tired too. Okay, let's have the group that I've called in. No, you remain, you're constant. The others will just join you. May I have a handheld? Handheld, please. Handheld. Okay, after that group, I'll expect persons from the industry. When I say industry, I'm talking about people. Okay, actually, before the industry, I'll request the medical doctors who have come to join us in this session to also join. Are we good? You give me the go-ahead photo. Yeah, okay. All right. One more. Sorry. Okay, Dr. Sabrina and team. Let's, all the medical doctors, please join us. I know we are also researchers, but just bear with us. After this team, medical doctors, including vet doctors, they are also doctors. Yeah, so please join us. Dr. Mullen from Vet, Covab. Yeah. Just a moment, wait. Camera, please wait. We have people coming in. Okay. All right. After this, we are going to have the person from industry. I'm talking about the AI industry. We have those persons that are from that area. Dr. Ernest Tim going to join us on the stage. Okay, people from the AI industry. AI industry, please let's join the stage. Healthcare providers, please get ready. Be moving. Healthcare providers, please. Rocket Health and healthcare providers. I saw somebody like, I saw on the list we had some people from Rocket Health. Okay, if we don't have, do we have them? I don't see them. Okay, one last one. I know we have people who have come from afar. Gulu, Pachedo. If you are that category, please join our guest of honors on the stage. Basically, I'm meaning those who are interested right now, who have not taken a picture, to join them. If you would like to get a picture, yes, please. Those who are willing to join them for the last picture. Okay. This is the last picture. So if you've not featured in any of the above, you can join the group, please. Our lead from data protection, Mr. Beck, I've not seen you going up there. Okay. One more person on the other side. I'm seeing being there. One more person. Okay, this is our last picture. As we do this, please, we are going in for a break. Please, we are going to keep it really, really, really short. And as we are doing the break, we're going to also be a guest of honor and team for being this morning. Thank you very much. So let's pass and pick our tags as we go for the break. The break is going to be a 10-minute break. We have already a lot of time earlier, and we started also late, so we would like to recover some of that time, please. DJ.
I want to welcome you to this lab. This is our new university.
And this is a project that is funded by Google. Is really to come up with distributed tools that reduce time and improve accurate disease diagnostics, and specific to the way we use the POPs, which is one of the tools for the of some of their diseases context. Malaria, to be able to visualize, to cross-code towards and rate these diseases.
There are exciting the technology maturing. There are challenges. It's to be careful when we don't harm good.
AI is a game changer. The reason for Makere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason the threat for Makere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is an important facility for you to learn and your academic.
One of our Ocular projects is a project funded Go. Work is really with decision tool to reduce and improve accuracy, disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason the threat for Makere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
My name is Surafil Sebetelahun. I'm an associate professor and head of the HPC and Big Data Analytics Center of Excellence of Addis Ababa Science and Technology University, which is based in the capital Addis Ababa of Ethiopia. I would like to thank the organizers for this invite. So in this talk, I would like to talk about AI in action, chatbot and other projects being done at the center. The HPC and Big Data Analytics Center of Excellence is one of the 8 centers of excellence of the university, focusing on developing a data-driven and AI-based intervention or solution approach for different problems. There are different research groups at the center, focusing on solving different problems from health, from economics, from agriculture, and so on. The application of data science and AI in health is one of the thematic area of the research group. So the projects include chatbot design for sexual and reproductive health in Boarding University, which is one of the sub-grantee from HASH project. The healthcare sector in Africa faces numerous challenges, many of which are complex and intertwined with the region's socio-economic, political, cultural, and infrastructural conditions. These challenges hinder access to quality healthcare and impact health outcomes across the continent. So some of the primary challenges include shortage of healthcare workers, limited infrastructure, cultural challenge, weak governance, policy issues, and so on. One of the health challenges in the continent is related to sexually transmitted disease. Reports are showing that among the sexually transmitted disease and infections, the majority is on the youth of age between 15 and 24. So basically, due to the lack of awareness and the lack of reliable information, and due to stigma, this plays a central role in this transmission. For example, if we take Ethiopia, for example, the youth experience an adventurous behavior when they join universities. after they finish high school, they will be joining one of the 40 plus public boarding universities. So it will give them a new sense of freedom, being away from the family or from a caretaker. Then that will put them at risk. Developing a digital tool which provide reliable information on STDs is found to be useful in these cases. Furthermore, anonymized chatbot to provide a startup diagnosis and recommendation is designed in this project. The designed tool has awareness creation part about STDs. It has a chatbot, a startup diagnosis tool, as well as a local information on the dynamics of transmission of STDs in the surrounding, as well as prevention mechanisms. If we take a quick look, a peek at the developed site, it has different sections. It has home, about, STDs and preventions, more focus on the awareness creation here. And we have the chatbot. After that, we have your surrounding to know about the dynamics of transmission in the campus and outside in the surrounding as well. And the nearest health center based on their GPS, and resources, reliable resources. So if we look at the chatbot section, it is a rule-based chatbot. So the user will enter or answer a series of questions, and the questions will be designed to follow a certain structure. For example, it will ask for gender. Then it will ask, do you have any unusual discharge? So if you are not aware what it is asking, you can click this I, and it will give you information both in the local language, Amharic, and in English as well, and links for further information to get more information, and nearest health center as well. In addition to this project, we also have different health-related projects on COVID tracing, hospital admission, especially for COVID patients during the pandemic, infant mortality prediction, as well as drug discovery are some of the projects explored in the center. The application of AI in the health system is wide and important, but it needs to be carefully considered regarding to ethical explainability and other issues. Thank you very much.
Welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason d'etre for Maker's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason d'etre.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason d'etre for Makerere's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason the threat for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
He has received a diploma degree in medical laboratory technology, a Bachelor of Science in biomedical laboratory, and a PhD in medical microbiology focused on tuberculosis diagnosis from Makerere University. He joined Makerere service in 2000 as a technical assistant and has since grown through the ranks to become a chief of teaching laboratories with Department of Internal Medicine. He's a medical laboratory technologist and the chief of teaching laboratories with sciences. His research interests focus on evaluating TB diagnostics, either in their early or late stage development, as well as testing completed diagnostic tools in clinical settings in order to gain real-world experience. I would like to now welcome Dr. Andama to take over the stage. How many panels do you have? 5. You have 5. 1, 2. So you won't sit? You will stand all the time?
Yeah, I can
1
stand.
hour?
Yeah.
Okay. That's well.
Good morning, ladies and gentlemen. Thanks, the moderator, for the kind introduction. I would like to start by inviting the panelists to come over to the to take up their seats. I will start by Dr. Daudi Jingo. Please, if you are in the house, walk forward and take a seat up here. We have Dr. Davis Musinguzi. please walk up and take a seat. Dr. Ruth Obaikol. We also have Dr. Ernest Mwabaze. And the next one is So please, those have read, whose names have read, please walk up and take a seat. Dr. Ruth Obaikol, Dr. Ernest Mwabaze, Dr. Davis Musinguzi, and Dr. Daudi Jingo. Daudi is here. Yeah. So to kickstart our panel discussion, I would like to, first of all, take this opportunity to give the context of this discussion. My name is Alfred, and as mentioned earlier on. It is my honor, ladies and gentlemen, to have the panel discussions here addressing Africa's healthcare needs through artificial intelligence. We know that artificial intelligence is rapidly transforming global healthcare, and Africa stands to benefit immensely from these advancements, from combating infectious diseases to improving maternal health and reducing healthcare disparities. It is anticipated that AI has the potential to transform some of the continent's most pressing health challenges. However, the successful application of AI in health requires a multidisciplinary approach, bringing together expertise from technology, medicine, policy, community engagements. So our panels today bring diverse perspectives to this context and expertise to crucially converse, and we look forward to their insights on how AI can be a game changer for African healthcare landscape. So I think we are missing one panel. I don't know whether they've just come in. I'm going to kickstart this discussion by
the doctor still has to make the fund could go through. So I think one area where it is still very delicate is actually prescribing a drug and telling you, hey, Daudi, you have this, go take this at this dosage. There's a lot of potential for it, but the problem is that we've not yet figured out ways of accrediting it. Because for a doctor, you can hold them liable. So if this thing messes up, you really have no way of holding it liable very directly. I think Mbaka did mention having to go through approval processes. I think Mbaka did mention having to go through approval processes. I think those are areas where
response from you expected challenges related to what you have response from you expected challenges related to what you have just described. What do you anticipate?
So I think all the data scientists and artificial intelligence colleagues in this room will agree that the biggest roadblock is with the data itself. It looks like there's a lot of smart brains that can develop a lot of excellent algorithms that are effective, and there's a lot of existing ones. But I think the biggest challenge we have is to develop our data systems. So collecting this data, of course, everybody knows garbage in is garbage out. So we have to develop very good data systems for one, knowing what data to collect, how to collect it, how to secure it, and because when you have data, you can really do a lot of very good data science and artificial intelligence. But above all, how to create trust systems around it. As they say these days, data moves at the speed of trust. So to the extent that we can start building systems that build trust around data, I think we'll be gaining a lot of mileage in beginning to solve that problem. But of course, you know, you have to collect it, you have to store it securely, and then later on you have to analyze it and interpret it. So there are also blockages in the human resource pipeline. It takes a long time to train a really good person. There's a lot of teachers and lecturers in this room. Somebody could go and do a 1-week course and become very good at a specific technique. But to get a person to a level where they can really thoughtfully approach a data problem and thoughtfully link it to a solution, that takes a long time. And I think that's an area where we still have a lot of, where we have a gap. We need to train and train diligently and train for the length of time that it takes and have individuals come through the pipeline. Because once, as they say, the most important resource is the human resource. Once that is sorted, I think there will be a lot of benefit for our ecosystem.
Thank you so much, Daudi, for those insights. My next question goes to Dr. Davis Musinguzi. The context is that there's a significant disparity that exists between urban and rural areas in healthcare provision. There are limited number of professionals that have been trained, especially for medical resources. AI has the potential to bridge these gaps through telemedicine, mobile apps, and remote diagnostics. So the question to you, Dr. Musinguzi, is that what role can AI play in addressing healthcare disparities across Africa, especially in providing quality care to the undeserved communities?
I think you mean underserved, not undeserved.
Sorry, yeah.
Because everybody deserves quality healthcare for sure. But I think first, I think almost every Ugandan is underserved in terms of healthcare. Even when you think you have the best health insurance, you're still not necessarily going to get the best quality healthcare out there. And that's because we have, you know, so many different infrastructure, human resource gaps, and so on. For instance, think about patients queuing up at Chirudu, for instance. You need to know, okay, am I going to serve based on, you know, first come? Or are we going to rely on what we're trying to do, triage, to identify who needs to be seen first? Imagine if we could have tools using AI, taking the different parameters at triage that can enable us to identify who needs to be seen first and who needs to be seen next. And simple tools in simple scenarios provide for better healthcare, especially where, you know, you have a very where you need to take advantage of the golden window on who you provide care to in a scenario where you have a queue of 100, 200 people. So also thinking about it also from the provider's standpoint, the medical doctor in this case, what can we do using AI that can make the doctor's job much more focused on the patient and away from any other administrative task? One thing that takes up a lot of doctors' time when they're actually seeing a patient is taking notes. We have seen that a lot of AI tools these days can be consultation, and on the side you have, you know, a recording of exactly what was said in audio, a recording of the transcript of what was said. AI can even write you the summary of what was said. AI can even help you extract from an international classification of symptoms and ICD-10 what the symptoms were and what the probable differential diagnosis is. Now, of course, ultimately, like was said earlier, we need to still leave judgment to the medical doctor to say, okay, based on my own judgment, this was the diagnosis, these notes have been reviewed and are correct. And that saves them a lot of time and definitely improves the quality of care and improves the standard of doctors that were not as good as to be better with AI than they previously were without it. And also when it comes to a point where you now need to provide a prescription, you know, there are several instances where you have drug-drug interactions, where certain instances where, you know, you need to pick one alternative over the other because of pre-existing conditions. And there are a lot of things to factor into a prescription that may not comes, and also just following up with the patients. And we can automatically have AI determine which patients really need follow-up sooner rather than later. And all of this can be automated, whether you're doing it within electronic medical record systems, whether you're doing it within telehealth systems, to be able to improve what we already have existing within our infrastructure.
Yeah, thanks for bringing that in context. And I think this is a real life situation on a daily basis the communities go through. There is a question of how inclusive will this be. Earlier on, Tony mentioned that a greater part of our community still believes in traditional medicines, witchcraft, there are those cultural norms. We have also had like cases where people even decline blood transfusion in the hospital when they need it. So how do we bridge that gap? How can AI become more inclusive in the context of being able to reach to every community that we access?
Yeah. So think about how the common man today, for instance, has interacted with AI. Most people's general understanding of what AI is only came to light because they were able to make a prompt into ChatGPT. Other people that knew of AI pretty much existed within universities and research, or statisticians and machine learning experts. But the common average person only knew ChatGPT as the way that they automatically got answers and computations and analysis done without actually having the expertise or the knowledge of how to do it. But then to be able to do that meant you had access to the internet, or you had a smartphone, or access to the laptop, and things like that. But then if you now think about how do you make AI more inclusive, you have to start thinking about what is the lowest common denominator that you can use to extrapolate the power of a technology. So we know that there are still some very simple technologies that people use: SMS, USSD, voice calls. How are we going to translate the input and output of AI into simple technologies? How are we going to have all this compute seated in the background somewhere else, but really how people are making input into these AI computational systems is by a simple SMS, or by an automated voice call, or by just calling a USSD code that does all the compute using all kinds of webhooks behind the scenes that provides people with the results and the actions, AI agent actions that they need on their simple mobile devices. I think that's the only way we're going to really make it as inclusive as possible. How do we abstract the complexity of AI into the simplest technologies?
Yeah, thank you so much, Dr. Musinguzi. Dr. Musinguzi is the Rocket Health. Thanks so much, and I think you are getting it from right the ground. Our next question goes to Ruth. Ruth works with the Infectious Diseases Institute, and my question to you is in regards to the context is that we have limited healthcare resources, and these include the medical personnel, the equipment, and the entire infrastructure in the health system. I know there are the Ministry of Health representations here, but the idea is to see how do we leverage on what you have in order to get better patient outcomes. And so the question to Ruth is, an AI-driven tools could help drive this and optimize these outcomes. So how can AI be leveraged to optimize the allocation of limited healthcare resources in the context of workforce planning, supply chain management for medical equipment and medicines?
Thanks, Fred. I think I would like to paint a low-level picture. And we all know how there's just very little money to run healthcare in Uganda. But if you're thrown in a very working and redistributing the very little or few staff that I had, of course, within a crisis, you have many people leaving, the hospital, and you're left with very little resources. So for me, whenever the story of limited resources is on the table, that's for me the picture that I have in mind. And I remember so much about how much energy I needed to put into making that hospital run. And when you see that picture at very micro level and you scale it up to the national level, this is the kind of situation that probably Uganda is faced with. Very little resources at a national level. And quite frankly, I think that when we talk about AI and data-driven decisions, this is where you make sense of the need to even use data more. I mean, are you able to visualize, are we able to capture data at micro level and have, computers help us compute and analyze, and at a macro level be able to see the complexities or the variations that are happening across the country and redistribute our resources in more meaningful ways. Of course, with that comes, like Paul said, when we are adopting these technologies, we have to have a different perspective in the way we manage. We cannot manage anymore in a traditional way, and that means if you have to shift staff and make decisions quickly, you have to have a very agile system and way of management. That means mindsets have to change if we have to adopt these technologies for decision making. But also when it comes to medicines, we all know, I don't know, many of us here, I guess, go to private facilities to get healthcare. But for many people who get their healthcare from public health facilities, to arrive at a hospital and not be able to immunize your child because vaccines are not available is a real challenge, or to find that there are actually no medicines. And you can find that maybe a kilometer away from that health facility, one facility has more medicines compared to another. So the ability for us to redistribute medicines and distribute them in a way that is data informed and seamless can be made to happen with artificial intelligence. But also talking about process oriented, and sometimes even the time spent to think more scientifically, bringing your mind and heart to work becomes less, and the things of moving, patients or doing the process issues are things that we find ourselves as medical workers doing more. By the end of the day, you've moved around more than human resources. As a nation, we can benefit a lot from artificial intelligence because it removes the pressure of process activities and allows healthcare workers to concentrate more on what what they're called to do the science and reach out to the softer side of what medicine can give to the client. So I think that it can help us to redistribute ourselves physically, but also within the way we deliver services. There can be more meaningful redistribution of care to clients.
Yeah, I still see a lot of huge trailers, vehicles moving with a lot of paperwork, distributing supplies across the country, and I'm pretty sure that happens in most parts of Africa. And in so doing, there's always a lot of error that come associated with that, and also loss, because anybody can create all this along the way. So what examples of resource optimizers through AI have been successfully implemented in Africa? I don't know if you have an idea about that. And
resources when it's needed more. Resources when it's needed most, and demobilize when you probably predict that not much might be needed. And I think for me that was demonstrated. And I think for me that was demonstrated best, how we can utilize our resources best, how we can utilize our resources in a much more, if we now deployed the chatbots in Kenya and Nigeria to provide health information to people in the population, in the communities. And I think for me, that has been one of the missing in healthcare. Our ability to provide meat, and I think that that's a huge contribution that the teams are providing. At IDI, we also, during the COVID pandemic, attempted to develop a decision support system. It came out at the end, but again, if you were able to provide AI-driven predictive tools, those are cheaper compared to the screening tools that we have to develop and procure. Those are really opportunities that I've personally seen, and I think that are going to change the landscape of, efficient healthcare provision in the continent.
All right, thank you so much, Ruth. I was just, as you were explaining all that, I was just thinking about, we've had recently MPOX. I wish AI would be able to predict when it will end or when the next wave will be. I am predicted that it will end in 2030. Recently, I asked a friend, we are left with about 6 years to go. But
I'm not sure, Alfred, whether that was an AI prediction.
All right, thank you so much. I know the audience has questions to this panel. We'll give you an opportunity to do that. The first three speakers were mainly from, so it depends on access to large volume of accurate and diverse data. However, issues around data privacy, ownership, and representativeness are significant challenges in Africa. So the question is, what strategies can be employed to ensure ethical AI deployment in African healthcare system, particularly around patient data privacy and security?
Great.
Recording in progress.
Not just
Recording in progress.
Not just IT. All right, I did eat the fish though. Anyway. But yeah, so the AI. I think one sort of reflection is the pandemic. For me, the pandemic was very revealing. It was sort of a litmus test, I think, for two people: one, pastors, and two, them at home, with masks, sanitizing. No one was going to heal people in hospitals. And the data scientists who up to get a real example of someone using data to make a significant change on the COVID pandemic, right? So it was very revealing, what the practical impact of some of the work we do is. And I really like the example Dr. Ruth gave of really someone down in the health centers. And we just recently went with the team, Rose's team, we went to the eastern region. I went to the eastern region, and I think Busiu Health Center 4 or 3. And I mean the people there, the office, the medical officers working there. I mean the amount of patients they had, the disease, diagnosis, and you can go and take a photo and get this data. So there's a lot of work to be done there. But I think to answer the question, maybe to go back on the more academic front, I think to do with data ethics, security, privacy, I think Becca is here. I'm sure he's going to talk on the next panel about the personal data protection office that has really stepped up. We've recently, as Sunbird AI, so Sunbird AI, we do practical AI for social good. We try and do the practice of AI, and we've been filling out our annual requirement with the PDP office, because they need to make sure that we are not violating the use of data in the tools we are building. So I think the first key thing is really regulation. And regulation both from the government side, which they're doing, but also internally from the organizations building these tools. Can they, or even consent, do people consent when you take their data for processing, this kind of thing. It's very important. And then also ethical building, responsible AI, responsibly building these tools. And I think something who talked about, maybe Paul, and I think Professor Tony as well, that we need to test these tools. We need to validate. There has to be some ethical checks.
And elsewhere outside our boundaries. I think it looks like the idea is to be able to build a database that should be harmonized across different regions, such that these remain robust, as it was described by Rose. So the question is, how do we address that? Lack of diverse and representative data to train AI that can effectively be applied across, the different aspects.
Right. So data. So they say data is the new oil. So data is a very interesting thing. So it's a commodity, unlike things like land or buildings. So land will remain there. Its value will appreciate, but you can say that's my land. Data is a bit complicated. So it's there, but it's also not there, right? So if you expose your data a bit, then it can transfer from here to the US to Canada to China in a blink of a second. All the data could go. It's very hard to hold data the way you hold a resource like land. And so how to manage data is definitely going to be very important. How to share it responsibly is even more important. When we've just recently been at a conference with Dr. Jingo here at a very good island in Mauritius. I don't know if the team organizing this conference, in which you look at them, they're not necessarily free. But sharing that data realistically in a meaningful way, I think is very important for this community especially. Thanks.
Yeah, so it sounds like the way around that will be to have a common pool where most of this data is deposited with probably some regulated access so that it's not abused. So as I mentioned earlier on, it seems a couple of people in the audience have questions to the panelists here. As I mentioned earlier on, we have Daudi Jingo right next to me here. We have Ruth Obaikol, the only lady on among the panelists. Then we have Ernest, who just completed speaking here. And then Davis Musinguzi right at the other end. So if you have any question or comment. So probably to kickstart that session, we have somebody online, Dr. Agnes. Please, could you ask your question and probably specify the person you expect to respond to that particular question?
She is a panelist. She was a panelist. Yeah. Okay, I think we can be taking the questions.
Right.
And I'll suggest, Dr. Ndama, we do 3 questions.
3 questions?
3 because
there's
of time.
a lady whose hand has been up for quite some time. You could start with her. Clear
Okay,
and very specific.
Thank you very much. The name is Margaret Nagovma, College of Computing, Makerere University. My question, thank you very much, panelists and team, for organizing. My question goes to Dr. Musinguzi, Davis Musinguzi. From the organizational perspective, we have issues when it comes to the AI paradox. Of course, here it's about redressing culture, structures, trust, skills, data sets. From an organizational perspective, I want to help us appreciate the fact that we are not only creating a destroy, but we have to look at how AI can be used to effectively serve the clients or the patients. Kindly elaborate on the AI paradox in the medical organizations. Thank you.
All right, thank you. Do we have another question from the audience right now? Yeah, there's Sabrina. Then we have a gentleman right there. So panelists, jot your questions. You'll respond at the right time.
Thank you very much, Chair or Moderator. My question is, to the panel is, to what extent does the national data support the work that you're doing? We don't know the total number of people in our country. We don't know when they are born. We don't know when they die. We are starting, but to what extent are you pushing to ensure that the data we have is accurate so that we can plan better for them? Thank you.
So the last third question is right.
Thank you. I'm Abraham, software developer. I think my question goes to all the people. Recently, I participated in a hackathon by Zindi, where Makerere was participating. I think they kind of put a challenge there on, I think, malaria detection something. I don't quite remember it. And they kind of puts a bit of care about confidentiality and all that stuff. So I'm just wondering, how are you guys striking a balance to avail data sets that can be used to train AI models?
Thank you. I think that was our third question. Before the panelists get, I think there was only one specific question to Dr. Jingo. You will respond to that. I think they're including you. But before we go in, she makes her remarks.
Can you hear me? Loud and clear?
Doctor, we can't hear you yet. Doctor, you there?
Yes, I am speaking.
Just give us a second. The technical team is working on our audio.
Okay.
Tech, we good? Doctor, let's try again.
Can you hear me now?
No, sound is still bad.
Maybe let me try and work that out.
Just a moment, let's work on it.
Okay.
Yeah, so in the meantime, we could proceed to answer some of the questions that were raised. Can we start with a specific question? I think it was to Dr. Singuzi.
So, first of all, thank you very much for the question. I think the way that I understood what you were asking is how organizations, and everything that happens within them in terms of their structure really going to align with taking advantage of AI. And I think technologically, there can be so many advancements, but what people sometimes forget is that technology changes organizational structure for you to be able to make the most out of that particular technology. And we all know that healthcare in practice has been the slowest in adopting any kind of technology, whether it's in diagnostics, whether it's in data or IT. It's always a very slow grind, and that's because people's lives and privacy and professionalism and licenses are at stake. And so there has to be, first of all, a high level of buy-in at a leadership level. And what that means is that leadership has to be very well informed and educated about what the positive net outcome actually is. Of course, there will always be some downsides, but at least there has to be agreement on positive net outcome. Because what that is going to mean is that what follows are key decisions to align with that positive net outcome in terms of about us are being hosted or managed in the cloud or on premise, and things about data governance. It means that those institutions have to be very deliberate about who they give access to, how they share it, how they secure it, and how they eventually use it to the advantage of the patients and the organization. And under pressure to also make a profit, affect our revenue and cost structure. yes, they may be good to have and they may improve quality, but if it's only improving cost and not really having an impact on revenue, then you can definitely expect adoption to be very slow, if not impossible. And we've seen this with electronic medical records. We've seen this with interoperability. If there is no incentive enough for people to adopt and integrate these technologies within their balance sheets, then you're going to have a very difficult time, even if, you know, it's fantastic technology in and by itself. So I think as we look into integrating AI, we're going to have to see and really evaluate its impact across the entire business. You know, are there going to have to be some, you know, fundamental changes that happen within an organization? And to be able to do this within an organization that already has incumbent structures or vested interests becomes another, you know, kind of political minefield. So yeah, there's a lot to really factor in. Some people will say that if you really want to integrate technology within an organization, you literally almost have to create a subsidiary that follows a different. The new entity grows to a level that then cannibalizes the previous one, and you then kind of, it's like molting or metamorphosis. And finding leaders that are willing to go through that metamorphosis as a result of technology can be very difficult. So yes, the challenge is out there.
Right. The second question from Sabrina, how AI could use, still trying to figure out how to best address the questions that were asked. I think that's the context. So that's open to any of you, including Musinguzi, how you could potentially support that that particular area. You can unmute and make your thoughts to the public.
I come from the same organization with Daudi, and I was looking at him, hoping that he probably has an answer. I think what I understood from at IDI, we have, and again through the department that Dr. Jingo heads, we have appreciated the role of AI and its potential ability to do so much more, just like we've discussed here, and with the Ministry of Health, and probably also and widen our collaborations. Just like Ernest was saying, you know, data is the new oil, and so there's a lot of interest. So we have to build trust. But I think that also working collaboratively and openly, we can't do this on our own. And for example, on the Makerere Hill, there needs to be a lot of collaborations between entities, and then, you know, networking with the Ministry of Health. And we're starting to have those conversations. I actually did talk to Rose this morning that, you know, we need to work a lot more together, and a lot more in a more to the data, given the privacy and confidentiality issues of this data. And I wanted to just say that in relation to this, I really applaud Mr. Mbaka and the team at DHI for, you know, translating the Personal Data and Privacy Protection Act into guidelines at the ministry level, because these have actually been launched, I think, this year, and they're available. And I think that provides a framework, a governance framework for us to operate. I think that the ground is now level, and there are already mechanisms that have been set for us actually to use data. Also, the Ministry of ICT probably is here. I know that they are working on the data use strategy, the national data strategy, and there's a lot of frameworks now available for data scientists to access data and use it to develop. So I think that Dr. Sabrina raises a very critical question for us to now, you know, step up and actually use population level data, because it's now available and there are frameworks that support us to do that.
Thank you, Ruth, for, I think you need to add something.
Right, I'll just add something quick. For Professor resources, and then with two, which is to say that each of those different fields needs to be very intentional about learning skills, and at least the general landscape of the other field, because in a very practical sense it will be very difficult. So I think that's one area which we need to pay attention to, in terms of integrating these fields. Of course, academically, we superficially classify things into, I don't know, geography, biology, data science, but we all know in the real world, all these things are very integrated, and we need to perceive them and handle them that way. So that's one thing. The other thing I think is also leveraging existing platforms to communicate about this data and how to use it. I think Dr. Sabrina is a vociferous user of social media platforms. And that's one area we cannot ignore in terms of, one, making these concepts and ideas popular, two, making them acceptable, and three, communicating real information about them.
Right. Thank you so much for your insights into those particular questions. Actually, one of the questions I've always asked the different people holding big data, Minister of Health, and others is
thank you so much.
we are talking about undergraduate and master students. My feeling is that they would actually become more innovative if they had access to such data, which of course regulated. It would make them really, really more innovative. We know for other data, for other trials, we're always very conservative with the trying things directly on humans. We would rather try them on animals, on plants, and other things. And then when they're safe there, we start dosing them in bits into the human being. Then once that is tolerated well, then we start taking it to the other populations later. So I think using such a concept, I think some of the login, if not, I think we should bring this particular session to an end. Please kindly join me in applauding the panelists here.
Just before they go, can we have the photographers take that picture, please, for the panelists? And then we can close that. As we get into the next session, Dr. Agnes, we are really, really sorry if you're listening to us. Please bear with us. We had a technical glitch, and it could not allow us to, have you on board. So we would like to welcome the next session, and allow me call Mr. Malumba Richard to take us through the next session. Just so we are aware, we might have our PS coming in. When the PS comes in, we shall at least do a pause on the panel, and we get an address before she's moving into another session. So let's just be aware of that particular moment. Richard, over to you.
Thank you so much, Mr. MC. Just like you've introduced me, I am Richard Malumba, and I'm the next moderator for this panel. And, I would like to thank the previous panelists. They've quite done a lot to handle some of these questions. And the next one is going to focus on the foundational elements required to build a sustainable AI ecosystem. And with us today, I'm honored to present to you the panelists that are going to be with us to discuss this this afternoon. First, to invite Timothy Biekwaso. Mr. Timothy Biekwaso is the technology and innovation lead at Asili 14, a Kampala-based business technology consultancy, where he manages the firm's technology solution roadmap. He's passionate about aligning technology with organizational goals to achieve impactful outcomes. So I think they share the same interest with Dr. Musingu's there. His expertise spans IT strategy, product management, enterprise digitization, and data governance with experience in sectors such as renewable energy, agribusiness, fintech, and EPC. You're welcome, sir. Next, we have Mr. Baker. Mr. Baker is an advocate. He's also the manager, compliance and investigations at the Personal Data Protection Office. He will be telling us what that means, and then he will answer our questions as well. But he's into much of regulation and implement. Dr. Fred Kagwai, welcome, sir. He is a lecturer at Mara University, Department of Computer Science. He's a researcher in data science for health, including big data security, biometrics. He's also the chairperson of Mara University Quality Assurance Committee and co-investigator of the Data Management and Analysis Core under the Mara University Data Science Research Hub. You're welcome, sir. Lastly, let us welcome Professor Peter Waiswa. He's an academic administrator. He's Associate Professor of Health Policy, Planning and Management at School of Public Health. He's a seasoned researcher with interest in maternal child health systems. He's also a visiting researcher at Karolinska Institute, Sweden. He also sits on the WHO Advisory Board for maternal, newborn, and child and adolescent health. But most importantly, he's my professor. So he's my teacher. You're welcome, dear panelists. So we've had quite a lengthy discussion with the previous panel, and they're talking to us about how we should use the data, what we should do to ensure that we have an ecosystem that is, good for us, that is going to yield positive patient outcomes. And in this panel, we're going to be discussing really the fundamental elements that are needed to build such a system, most especially looking at the uniqueness of our setting. We are resource constrained, but then we need to prepare for this child. We need to provide housing. We need to provide the basics that it needs to grow, to work. That's it. I will throw the first question to our panelists. So, Africa's healthcare challenges are distinct from disease burden patterns to, the resource limitations. But how can AI be tailored to address these unique challenges rather than relying on imported solutions? This can go all the way. All you need to do is just open your mic, and then we start the discussion. Yes?
Thank you, Richard. Is that specific to anyone, or?
Yeah, anyone, but you can go first now that you've opened your mic. Thank you.
Okay, thanks, Richard, once again, and the speakers that have helped shape the context of this very typical conversation today. I hope I can be heard. Generally, we do believe that building a sense of community is not only fundamental, but also it's an imperative for us where we are at this stage, which is why I reserve enormous credit, and I'm sure many of you do, enormous credit and gratitude even to partners like the Makere AI Health Lab, among other AI working groups and stakeholders that are leaning in this conversation and these practices. Building a sense of community, and I think it's critical that everybody in this room appreciates that building a sense of community really does represent the intersection between three core aspects of our undertaking as an ecosystem. And I think the first is purpose. I'm sure Dr. Rose and her team have purpose at the core of what they're doing, as is the case with other stakeholders. So purpose being the first one, shared goals being the second aspect for us that is critical, And then finally, the rules of engagement that guide our in learning. Because as we've seen through the adaptation and the proliferation of new technologies over time, it is something that necessitates it. And so to speak, both the AI adaptation and its proliferation still remains subservient to the notion of the increasing density of computer chips. Moore's law, I think some of you may understand it as Moore's law. Where we are now, that's not going to change, and I think if we have any anthropologists in the room, they will appreciate better that this typically is what defines wealth creation, career creation, and not the wealth creation in the context of our socio-political construct, but wealth creation in terms of how, as mankind or as humans, we generate value or economic productivity. So I think to answer the question, first I think I would like to paint that context. But speaking more specifically to how collaborations or partnerships can be fostered in the ecosystem, I think it's critical that we consider the foundational elements that have been discussed since the morning. Things like robust infrastructure, sound policy frameworks, the skilling element as well, and even our reason for being here, the interdisciplinary or intersectorial collaborations. These four, I would suggest, are foundational elements, which we can come back to later in detail, that are very critical for us to create an ecosystem that is sustainable, really. I'll take it back to you for now.
Thank you. Thank you so much for that response. And you've mentioned something that is so pertinent of late when it comes to health interventions, that is community engagement. Dr. Kagwa, how can AI, how can local communities be engaged in co-creating AI solutions to ensure that they are culturally and contextually relevant in relation to community engagement, which Mr. Timothy has spoken about as one of the fundamentals? Thank you.
Yeah, well, hello. Yep. I think I may need to hold it as well. Thank you, Richard. Well, do we know what the community needs? That is the first thing. So we need to co-create, and co-creation is creating something with one community. So that is one of the wrong things we are doing. Lots of solutions are coming up for the community, but not with the community. And that is really, really critical to start with. And then, two, do the communities understand what the AI is about? Do we have some education programs that are running through these communities to just give them awareness and trust in the AI? So that is also really, really critical for us to be able to bring on board that at least everything we are doing is understandable to them. So if we are to design applications, we also need to co-design. Do we have the local health leaders? Do we have them participate in the interviews or discussions that are going to generate these AI solutions? Or we are imposing solutions onto them? We know it better. That's the idea that we always come with as academicians or as tech people. We always have this mind that we know what you want because we also live in the same environment. But the challenge is we may live in the same environment, but we're not surfacing or we are not linked up to the same areas that other people are working with. So we really need to involve them, bring them on board, and make sure that at least we get their experiences and then have this work together. One interesting thing is we are losing the it will actually come on board. There is indigenous knowledge that we can generate and have this in the knowledge databases. And so as we are developing tools or AI solutions, they are going to have the people's experiences, the local experiences. And at the end of the day, they are getting involved in providing solutions. Someone earlier on talked about asking ChatGPT to give you in a local language in terms of developed. Then we know that we have AI that is collaborative in terms of involving quite a number of people. So basically we need to work with the communities. If we leave them out,
for a person who is in Katanga, for example, because they need to get involved, where does he start? What does he need to do?
Recording in progress.
Yeah, thank you, Richard. Ernest, we need to go down to the Montuawansi and reach out to them. He should not think for them. He needs to go down, have maybe community engagements. There could be communities. We have a well-structured country developer. They need to get down to the people. I think the bottom-up approach would, at some point, really yield more inclusiveness in terms of picking out what the people down are going through and making sure it is well represented. So going to Katanga would be very good, and have maybe focus group discussions, maybe community engagement, and real observation of what is going on, rather than assuming or rather than getting a satellite of what is going on. Visiting the place would really be very important, and the people would feel that you are with them but not for them just. But yeah, it is not enough to be for the people, but it is also important to be with the people. Yeah.
Thank you so much. Turning to Prof, you try to improve child and maternal and child health in Uganda.
Yeah, thank you so much. What I would tell Rose and team is, one, the healthcare is very complex. And like Mr. Mbaka explained, it is very regulated. So to begin with, I always ask the question, what is the problem that you are trying to solve? Whose solution is the AI? So until you answer that question properly, it is not easy to develop an appropriate solution. So understanding what is the problem that you're trying to solve. And unfortunately for healthcare, a lot of this is regulated by policy and alignment. But like one presenter said, sometimes we need to disrupt these issues in order to leapfrog where we are. I could give one example. You know, we are a country of young people, many children, and they say they are the future. But also we have a lot of stunting. Almost 1 in 3 children in this country is stunted. And we say that if you are stunted, you cannot achieve your human capital potential. So this is a big problem that we need to be addressing. Now, without understanding the problem, so we need to characterize these problems and say, are they also the priorities, let's say, for the health sector? So that's a very important part. Now, developers alone are not actually able to do these solutions without the technical experts in those areas. So they need to work with health workers, and also I must say, like somebody has said, also with community members, and of course other people, because even health solution that is integrated, then most importantly, you are going to be able to help this health worker, but also to give the right treatment for a child. So we always think about a diagnosis as not singular, like just malaria, but maybe what else could we do? And could we integrate maybe prevention? Because that same child may not also be immunized. So technology alone may not solve the problem, but actually we need to understand the problem. So understanding the problem, which is this child surviving, and you want the child also to thrive. And that requires to understand complexity and how to deliver it. So technology can actually contribute, I think like Dr. Davis explained, to solving part of the problems so that the health worker can focus on some of the other issues.
Thank you so much, Prof. And in there you mentioned the point of integration. And this, of course, calls for skills. So for the guys in, in Kampala, in some of the labs, they have the skills. Probably they can even do better integrating these. But how about the rural area? How do we bridge the skill set gap that exists, utilizing AI and integrating it with the delivery of healthcare, routine care, that is? Thank you.
So actually, rural healthcare, which is for our country, represents over 70% of the population. I usually say it's characterized by vulnerability. In many ways, they are illiterate, they are poor, they actually are very far from everything. They don't have electricity, and many times they can't also afford the technology. And so if you are to find a solution, understand that context, like I said, understand the problem becomes important. If we can find solutions which can work for them, that becomes important. For instance, if they are literate, then like you can use voiceovers. Some people say we are one of the most diverse countries. But from where I come, these people, and we integrate. Then I think it's also been said in the other sessions, sometimes you want to refer because you have a condition that who can provide more help is important. And sometimes we say we can use virtual systems and stuff. But in the end, we must integrate the technology plus the skills of the people. So as we do the solutions, we must know that, yes, technology is one part, but also in the end, yeah, somebody talked about robots and stuff in the morning to do surgery, but I think we are not at that level yet. The robot
number of tools which really cannot operate in typical rural settings. So we need to think of low cost solutions. They are still AI, but they are low cost, and maybe they actually do not also demand a heavy load in terms of data or internet. This supports the local person in terms of acceptance, usability, and taking on AI. Yeah, thank you.
And of all the solutions, rather the responses that have been given, you've also talked about the local solutions, other than the mobile phone, the USSD and all that. But all those need a digital structure, so to speak. Mr. Baker, how can such infrastructure be availed? Infrastructure that is sustainable for us to have a sustainable AI ecosystem.
So can you hear me? So for the solutions, I'll start from speaking from the government perspective. I work with the Personal Data Protection Office. I thought with my height I can be able to get it without lifting. Okay, clearly there is an issue. I need to hold it. Okay, so I work with a government agency that collaborates with the National IT Authority. I work with the Personal Data Protection Office. It's the regulator and implementer of the Data Protection and Privacy Act in Uganda. NITAU, the National IT Authority of Uganda, has infrastructure that can support, and they actually have programs supporting elements to do with hosting needs around AI. And what are some of these needs? So definitely AI being foundational with data, that data needs to be hosted somewhere. So the data center, and as it is with any infrastructure, especially with hosting, you have the main area for the data center or storage, which should also be mirrored. Mirrored in the sense that you have a backup. So government already has that. The data center is in Kampala, and the mirror, what we call the disaster recovery that can be used, is in Jinja. Government heavily invests in it. So how it can actually be used is creating solutions and offerings for these developers, where they can get hosting free of charge, others at a subsidized cost. So that is also one of the ways that can be scalable. But the earlier presenters talked about the power issue in Uganda. We all know it. So the surge power is also expensive. Solutions have been also developed, greening, whereby now using also solar, there is a loan which has been, loan and a grant been granted to NITAU to scale up this data center and have solar panels used in ensuring that it's up and running. Data centers are very expensive to manage. So if you're relying on the usual hydropower, one, it's unreliable, it's very expensive. So that means you either have to use the fuel. The fuel is equally very expensive. So with that, using the solar, it will make it more sustainable. But just doesn't stop there. The other challenge that we've seen, especially in Uganda, that those that come up with these solutions, they don't know that the solutions need not be targeting the Ugandan market only. So when you come up with an AI product, then you may consider someone within the region or even Europe. And with them, they are very concerned about data protection and privacy. So the regulatory framework can also support. Good enough, the office where I come from, it implements that law. And Ministry of ICT has also developed the national data strategy. Now that's right within that, so that when these solutions are actually built, they can be used by other countries, and that assurance is given of the existence regulatory environment, but also of the solutions. I'll end with something mirroring at the regional level. The East African community is also coming up with a strategy around data. So this strategy will ensure that infrastructure is available, still speaking to what's in Uganda, but it doesn't stop at just the East African community, which has 8 partner states, but also at COMESA, which covers a much larger part of Africa. That way, these solutions, they can be developed locally, served regionally, but also even scaled internationally. Thank you.
Thank you so much. Now, one of the panelists earlier mentioned that data is a bit a complex thing. It is there, but it is also not there. Today it's in Canada, it can move to the US, to Uganda, and all that. And surely you're from that office that regulates. I mean, we also know that the different countries have different policies that are regulating and managing. And of course, when you come to Uganda, we try to have policies that are tailored to our own setting. As a regulator, how are you going to address that challenge? That today we share data with colleagues in maybe Kenya, even in Canada, but then we don't have the same policy frameworks. There are some changes. How do we handle that? What is your office looking at to have that solved?
So that challenge, it has been observed from the regulatory requests on interpretation of the law that we receive. We track them. In the last year, we received over 100. But realize of those requests on interpreting the Data Protection and Privacy Act, 60% of them were on that particular question of how do you align with another country. We've joined our forces with other countries, starting with the East African community. East African community, a study was done and realized that the laws are largely similar, but when it comes to cross-border sharing of the data, the challenges are immense. So a regulatory framework will be developed. They're going to develop an East African Data Protection Act, which will work in a way that all the acts so far there are 5 out of the 8 partner states, they will be superseded, and that it will make it a lot easier to share and move data across the region. But it doesn't stop at the East African community. At the continental level, there is an agreement called the African Free Continental Trade Area Agreement, AFCTA. So it's an agreement, and it's one of the widely adopted agreements on trade in the region. Close to over 97% of the countries, including Uganda, they've signed it. So it's making it easy that if I'm in Uganda, I can sell my product. It has what are called protocols. Protocols help in implementing that agreement. And of those, there is one called the Digital Protocol, Digital Trade, and specifically around cross-border data transfer. So there will be a committee set up, and it will ensure that it's actually done seamlessly within Africa.
Thank you so much. Mr. Timothy, collaborations, partnerships, you know, a fundamental element if we want to have a successful, you know, ecosystem. However, what AI solutions or interventions can be thought about that can bridge the gap or that can bring together the tech companies on one hand, we have the healthcare provider on the other, then we have government or regulators?
Invites us to look beyond simply the new solutions or the new approaches to problem solving that we are going to come up with because of this new technology, but also make very, very critical considerations with respect to scalability, affordability of these solutions, as well as the ethical alignment that is really, really critical. So in terms of what AI solutions, I think it's an open conversation. The principal of the College of Computing, I think, rightly pointed out, for instance, earlier in the morning, that we've got to look, for instance, beyond computer vision and look. I think closely to this, I would invite us to also think about these foundational elements, you know, through the limitations that have us Africans on the back foot, as I said earlier on. And I think the reason this is important, especially for purposes of this discussion, I choose to interpret these 4 foundational elements as competency areas, if you like. And the reason for that is the collaboration. We've had the conversation, rather the reassurance from some of my esteemed colleagues in government in terms of fulfilling, for instance, the digital connectivity, high-speed reliable internet. That these are very critical in the infrastructure sense, in making us realize the full potential of these solutions. But besides that, of course, computing power and data centers, a role that private sector players as well as government have to play. But moving from that, again, in relation to the solutions, I think one thing I want to chime in, my colleagues spoke about skilling and the human resource element that has been emphasized since morning. I think it's critical generally that we nurture certain skills in children. Between the marketing buzz of a solution that actually works and addresses an issue, and simply you know, a product that may be put out there, as my colleague mentioned, without considerations of, you know, diversity.
Now back to culture, but as well as not to prevent or not to stop innovation when it comes to developing AI solutions.
Mr. Richard. Okay, let's welcome our PS MOICT, please. All Ministry of ICT and National Guidance.
Thank you so much, MC. You are welcome, our dear guest. So, yes, Mr. Baker. The question was, for any successful intervention to be implemented, or for any intervention to be successfully implemented, we have to bear in mind, or we have to take care of societal, aspects, values, and culture. What regulatory frameworks are you putting across to put that into consideration without, curtailing innovation, but also, fostering the implementation of AI solutions?
Thank you. For that, I'm going to use an example. The AI solution that the Personal Data Protection Office adopted, because yes, PDPO is a regulator, but it's also in the same sector. So when the office was operationalized in 2021, being a regulatory body, so it implements the law, a lot of awareness. And in the second year of implementation, we we came up with a website where individuals could get information, and then we used the USSD SMS platform for them to be able to complain. Within a week of having that, we received over 1,000 complaints. Then by the time we reached 2.5 years down the road, the complaints had reached almost 10,000. But the number of employees and those engaged in the office didn't increase to the same level. And we had a number of challenges. One, the law requires us to receive the complaints and resolve them within a particular period of time. And of course the public, and this is not in any way to crucify you, they say, but this government doesn't work. You complain, they can never understand the challenges. So we needed to come up with a solution to be able to address it. So we looked at the environment, of course looking at the law, starting with the Data Protection and Privacy Act, that if we are to adopt AI to be able to manage this challenge, law already recognize use of AI. There is something called automated decision making, that if you are to use automated decision making in any of your processes, then have an element of human intervention. So we noted that, but then we also looked at the Electronic Transactions Act. It was enacted in 2011. It's part of the set of AI, anesthesia. And we understood and said, okay, we want to see how we can quickly categorize the complaints and resolve them. And the solution, they helped us develop it. But like the other panelists have been talking about, understanding that context, because for them, the developers increased our productivity, having understood the different people that we serve, someone in the village, in an office, someone in Chikubo who is just concerned. And with that, we're able to realize that many of the regulatory environment, human interaction, were able to develop a solution of AI to resolve the complaints, but also to comply with the law, which and of course it became more effective.
Yes, as Dr. Kagwa comes in, how do we build the trust then?
So building the trust, still with data protection and privacy, there is a principle called transparency, that if you're to deploy AI solutions in your operations, even if you're private sector, the law requires that let individuals know. Because within the Data Protection and Privacy Act, it says, if decisions are to be taken that will have an impact on the individual, people, what we call data subjects or the individuals should be notified that AI was involved in coming up with something. But if you want to appeal or talk to a human, there is a phone number, an email address, a person you can interact with. But we also let them know that this is something which we actually keep improving. So individuals know that something is being done, and whichever decision is taken is based on a solution and they even have an avenue of speaking to a human, it increases their trust.
Thank you so much. Dr. Kagwa.
Trust requires, of course, transparency, like he just said. We need to explain these AI tools to the people, which data they are using, and of course the privacy measures that we put in place for protect. Think about is the sustainability of the ecosystem. Who are we creating this ecosystem of AI for, and how are we going to make it sustainable? If we do not have sustainable feedback mechanisms, it will die out. Let's say, for example, you have a grant, you've done very good work, very nice solutions. When the grant ends, there's no more feedback. Yeah. Let's say the government has put a lot of infrastructure, it is working, and etc. They did surveys and etc. But there is no continuous feedback coming from the communities, from the towns, from the cities. Then it's useless. And one very core aspect for AI to help us, to improve us, it needs to learn. AI needs to learn and learn and learn and learn. And it cannot learn without feedback mechanism. So for us to really have a sustainable ecosystem, we need to also have sustainable feedback mechanisms that really can support this. Feedback is a very serious backbone for a sustainable ecosystem for AI.
Thank you so much. Prof, lastly to you. For this mother who has a child and she has gone to a health facility, how do you prepare her for these solutions, the AI solutions?
So for many of the mothers, and I must also fathers, and maybe the entire community, they actually don't, depends on the issue. Some issues are so personal. So if you have a gadget and maybe things about sexuality and things like that, then you must explain to them. That must be the first thing. In Makere, in Iganga, we have demographic providers. We talk about respectful care, that most health workers, and this is one of the problems with how do these solutions integrate issues of human communication and emotions.
And lastly, Dr. Kagwa, how do we move forward from here, from this conference? We want to build a sustainable AI ecosystem. What are our next steps?
Well, I have quite hinted on a number of points, but like I've said, the infrastructure, we have been assured there's some kind of infrastructure from government. We have the researchers, we have the partners, we have funders, we have loans all over the country. But how do we collaborate together? If we are in silos, we cannot really have an ecosystem. Before COVID, we suggested an ecosystem which is published at Harvard Medical School. You can look it out. And without that collaboration of all of us incorporated, if the government is working alone and thinking by itself, the academicians actually are not feeding in the government most of these AI plans, because lots of works are being done. There's lots of solutions out there. If the government can move out and see the different universities, what they are working on, the different institutions, what the research institutions, the things they are doing, they're tremendous. There's a lot of AI moving out there themselves. But of course, collaborating and working together is very important. But for us to keep it sustainable, we must keep the feedback loop continuous. Otherwise, it will die out. Thank you.
A feedback loop. Mr. Baker, from the regulation and policy side, from here, what are our next steps?
I'll just build on to what he said, Kolabdi, to be more involved, where guidelines, regulations are shared, please share comments. Make sure that you put in a bit of time. That way, it can inform the regulation and policy. So it's basically about more collaborations.
Thank you so much, our panelists. Our audience, our panelists have been Dr. Kagwa, Fred, lecturer, Mbara University, Department of Computer Science. Mr. Timothy Biekwaso, who is the Technology and Innovation Lead at ACIDI 14. Mr. Baker, who is from the office.
Just line up and take a picture. As they do that, I'm going to give a gift to someone who answers this question. Please ensure the microphone is moving around. So my question is this. In Africa, we say it takes a village to raise a child. With AI in healthcare, who can finish that statement? I need 2 or 3 people. In Africa, we say it takes a village to raise a child. With AI in healthcare, I need 2, 3 people to finish that statement. In healthcare, with AI in healthcare, the microphone is moving? Yes, we have a microphone. Okay, we have 2 hands this side, 3, okay. In Africa, we say it takes a village to raise a child. With AI in healthcare.
With AI in healthcare, umutonzi yasalao.
Okay, that's number 1. Let's hear the next one. With AI in healthcare?
With AI in healthcare, it takes data.
It takes data, all right. I saw a lady, Irene. There is more, okay, there's another lady behind. Okay, all right.
With AI, it takes a multidisciplinary team.
With AI in health, it takes a multidisciplinary team. Do we have a hand behind? Then you're going to cross over again. Okay, we are breaking. It's just an icebreaker. Yeah.
With
yes.
AI, it takes network, collaboration, and innovation.
Takes network, collaboration, innovation. Okay. So far, I can tell you nobody has gotten it right. But we're going somewhere. We have some hands behind there. Yes, with AI in health.
With AI, it takes a multi-sectoral collaboration to create a sustainable ecosystem.
I will not be able to repeat that one, but I'll say, yeah, multi-sectoral, okay, that one. Okay, there was a lady behind, okay, all right, Dr. Ndoma.
It takes the whole community.
Takes the whole community. We have a lady behind. I saw a hand, okay, all right. Hey, there's a hand here. Dr. Fiona has a hand up.
Takes the village out of health.
Takes. Huh. Oh, my God, my God. This is interesting. Okay, we have the last one. Let's do the last one. Okay, 2 last one. 2 last one.
It's everyone.
With AI in health?
It's for everyone.
It is for everyone. We have a lady behind you. Then the gent in, yeah, then we close it. With AI in health?
With AI in health, it will need that we open up data sets so that people can innovate.
We open up data sets. Okay, very interesting, very good.
All right, it takes a community to ensure their well-being.
It takes a community to ensure their well-being. Now together, repeat with me, co-collaboration. Repeat with me, co-collaboration, co-design, co-partnerships. Now, from everything I've heard since morning, we've been talking about these things. How do we collaborate? How do we partner? How do we design together? It takes a community, it takes ABCD. So all those things, put them together, I think we are headed somewhere. So I would like to, with that icebreaker, nobody got it, so I got it right. So, yeah. Allow me to introduce the next speaker. Just before she comes, I'm going to read something about her. She is an experienced IT professional, passionate about embracing digital transformation to improve business models, service delivery, and transform people's lives. She provides strategic and technical guidance on how various sectors can leverage innovation, digital solutions to solve their problems within academia, government, and in the private sector. To this end, she has played a big role in strengthening the linkages between academia, industry, and developing policies, strategies, and program documents for funding partners that align IT with government development agenda. She has specialty in business process re-engineering, systems integration, e-governance, and information security. Allow me to introduce our permanent secretary to the Ministry of ICT and National Governance, Dr. Amina Zawede.
Good afternoon to you all. Good afternoon to you all. I bring apologies from the Minister, the Honorable Minister of ICT and National Guidance was supposed to be with us to pull off this, emerging trend that everyone is talking about today. Artificial intelligence, and what a best way to start it than to, have it in health, which touches everyone's heart. The AI in Health Africa Conference, for those that are coming to join us from outside Uganda, you're very welcome. To Uganda, to the Pearl of Africa. And I pray that you get time. Many calls, but yes, we are collaborating and partnerships. So I really appreciate the partners that we have on this, that have helped us to have this conversation of AI in health. That is my own ministry, the team from the ministry. I appreciate you. We have Google, I'm reading them from here, Lacuna Fund, my student Rose, is working on the Ocular project, supervised her together with my colleague, Dr. Ernest Mwebaze. Also, please stand up because this is our product to celebrate. They say it takes, please sit down. They say, yeah, the MC said it takes a village to grow a child. It took us to grow Rose, and Rose has grown this community. So we thank you very much for that. Artificial intelligence is one thing that is currently at the heart of government. This year, around, I think it was August, information in the country. And out of the resolutions that we, academia at the forefront of so many findings, so many solutions, and then they would collect dust on the shelves. But today we are embracing all the solutions and technologies because we believe that for digital transformation to grow, we have to come up with solutions that are sustainable. And we have to come up with solutions, and you can only come up with solutions that are sustainable if you know the environment you're working in, and you put everything into context, right from the ease of use, the 10, I think even 15 years, when Ernest was doing AI for cassava. It was over 15 years ago. We started doing AI for crops, for agriculture. We moved to AI for health. We have done AI in education. We are doing AI for tourism and AI for so many things. So it is the talk of the day now. As I speak here today, I know media is covering this event, but every Ugandan wants to appreciate what we are talking about, developed. So transforming the potential of AI in healthcare cannot be deniable, in particular for health. It is being used to improve diagnostics of diseases and improve diagnostics of patient care, as well as determining what health disparities that we have. AI provides us with unprecedented opportunities to advance our healthcare systems. And as a country, we are very well aware of that, but people ask questions day in, day out. Some do not know what AI is. Others do not know how to appreciate it. Yesterday, the Ministry of ICT is leading the digital transformation program, and we were presenting the performance of a digital transformation program in terms of having implemented. We're accounting to the public, what have we done in so many facets? What have we done in terms of connectivity, in terms of infrastructure, in terms of mobile phone penetration, in terms of internet usage? And then questions came up from the, from Ugandans. What are you doing about AI? How are you going to regulate it? What are you doing about cybersecurity? These are the questions now Ugandans are asking. So it's no longer questions for academia, but it's questions that everyone wants to address. And as a Ministry of ICT and National Guidance, we believe that governments play a pivotal role in creating an enabling environment that nurtures innovation, attracts institutional support, and ensures sustainability. We cannot implement whatever recommendations have come up here that I listened in from the panel without partnering with all the stakeholders, different stakeholders. If we are talking about AI in health, we have to skill people. You can't do without the education system. You can't do without academia. You can't do without government itself, the private sector that is going to support us in rolling out some of these solutions, the development partners that will help us do work with experts or do knowledge transfer and even funding as well. The civil society, the communities, and the different sectors that we have. So our role as government is to establish the conditions that are required for this to happen, and then come up with the right policies, right regulations, guidelines, and how to enforce these. As a country, we are very good at coming up with policy documents. Believe me, even with this AI policy, it is going to happen. But then we fall short of implementation, we fall short of follow-through and enforcement. That is why things go wrong. But since I have the majority of this audience, I have looked around and seen a number of you are researchers. I would like us to consider, as we have the engagements and collaborations about the policy, let us also think through the implementation strategy for this policy. So that by the time we are having a policy, the strategy is in place, we have looked at all the risks that one would encounter as we do implement and even come up with proposals for recommendation, then we shall move very fast. The ministry, through the Ministry of ICT, government now has a national digital transformation roadmap that has prioritized what we need to put in place for us to act a digital transformation roadmap. Expanding digital infrastructure, making devices. This was not prioritized in our roadmap because as a country, and we are not saying it's not important, but prioritizing is what are we looking at in the next, or where is our area of focus in the next 5 years? we assessed and found out that what it takes for digital transformation to grow is one, an enabling environment. You have the laws, policies, regulations, you have infrastructure, you have digital services, you have skilled your people, you have invested in innovation and entrepreneurship, and also you have taken care of things to do with cybersecurity, data protection, and all that. But when we looked at our enabling environment, we have very good policies in place, very good laws, as is, and implemented and, you know, done so well. So we said now our focus should be on enforcement and seeing how we follow through these various policies and regulations. So we were, and when we did a dipstick analysis on how we were performing at about 77%. So Uganda is doing very well. 77% in terms of having the good policies in Africa is a very good win for us. So clap for yourselves as a country. Then, so we now prioritize digital infrastructure, digital services, taking as many services online as possible. And of course, AI solutions are some of these services that we are looking at. If you have some account, you're transparent, you have data that is going to inform decisions that you make, and so on and so forth. Then we are also prioritizing cybersecurity, data protection, and privacy. And along that, I think now AI has also become part of those priorities. Ensuring that the systems that we are developing or applications are secure. We have created awareness campaigns, and so that people know what it means to operate in a safe digital space while protecting the interests of people through data protection. Then we are also prioritizing on that roadmap digital skilling. Digital skilling is very key and essential. Some of these solutions that we are talking about for health require, if I may recall, Rose did research of improving optimization of diagnosing take and are using mobile phones or applications to do this diagnosis. So she was improving the optimization of analysis of those malaria parasites, very complicated biology terms. But what she had to do was to train lab technicians on how to use the devices she was using, and also on how to do the various analysis they had to do. So if they were emphasizing skilling at all levels, AI is more specialized, but even the basic skilling for somebody in the market, to maybe a farmer or a market vendor, to identify which hospital they should go to, or if there's an app that is able to do a blood sample analysis, for them to do that, it requires that you have to have a number of skilling campaigns to be able to cover the skilling gap. And then lastly, the priority number 5 of our roadmap is innovation and entrepreneurship. Given that we are a young country, for those of you who have listened to my speeches, I always talk about the population of Uganda. As at the last census, we are at 46 million people, and 77% of these people are young people below the age of 30. And our population is now at about 16 to 17 years old. Do we have any 17-year-old in this room? So all of us here are outliers, or are in the 30% of the population of this country. But the good thing is that we are switched on to deliver solutions for these young people and know what to do to support them. For those of you who are in academia, it is very important for us to, because Ministry of Education has changed its curriculum now to be able to embrace digital transformation. But also you at university level, we have to be more intentional. When I was at university, we used to have capacity building, projects. And I think everyone at Makerere now has a PhD or is doing a PhD. It is normal to do it. So capacity was built for staff at the university to be able, first of all, it was, yes, building their capacity, but it also gave people exposure on different environments to also, give to the students what you got back. In this era of artificial intelligence, how are you going to AI as only for to ensure that every teacher that qualifies from a teacher training college or from university comes out with a certification in digital skilling? And why are we saying that? Because, we have so many teachers today who go to class and the students are even better than them at using these devices. They don't know whether the student is using it safely or not safely. So we want to teach them to be on top of their game as they engage with our students and our children. So that is one thing that is going to happen, because what is currently happening is that IT is seen to be for computer science people only, or College of Computing only. Now we want it to be spread across the board. And then all the solutions that we are talking about here today, even the ethical ways of dealing with artificial intelligence will be better appreciated if everyone is educated. On innovation, we are very aware that we cannot flourish without skilled individuals to drive it, and therefore government has actively integrated AI and digital literacy. We are doing a lot of training here and there. The reason why I came late today is that we had an earlier event, the International Telecom, one of them. And cloud computing, augmented reality, and so on. So there are a lot of efforts everywhere, but it's still with the slogan of collaboration, partnerships, and co-design, we are going to see the impact grow. Now, to our health sector has also benefited a lot from ICT advancements. We have seen telemedicine platforms and digital health solutions such as the DHIS2 healthcare delivery, and also improved disease surveillance and management. These innovations are helping to bridge the gap in healthcare access, especially in rural areas. And some of these solutions were initially, for example, the DHIS2 is not a locally developed solution, but we have developed the capacity to develop local solutions over time. And we are going to do generative AI for us to produce better and more precise results. In other sectors, we have grown some own homegrown solutions, like in education, we have developed the Education Management Information System. If you have children in school, they are now required to do registration on some system. That is our education management systems. Teachers have been registered, so the issue of having ghost teachers is going to become history. We are using the system to inform government to give the right capitation grants to schools. Because before they were giving out grants, in a layman they say anyhowly, but I'm on TV, I hope you cut that out. But they would give out without having any data to inform the decisions that they are making. But today, there are so many children in this school. These are the teachers that we have. Or if there are few, how can we get more teachers in that school? All that is being informed by data. And for a solution that has been developed by our own Ugandans. Then we have the parish development model program. This program is talked about by the president everywhere he goes. It's a program that is helping people in the subsistence economy to grow to a commercial economy. We are giving them loans to do various business in agriculture. And then we expect that with that, they'll be able to grow their financial potential. But Ministry of ICT has worked together with innovators to develop a parish development management information system. So today, every beneficiary of the PDM money is known. We know the person, we can even go up to their home because we have registered them and have got the GPS locations of their houses. We can know how much money has been given out, the various parts of the regions, etc., etc. Of course, with that amount of data collected, now AI can come on board to help us improve the efficiency of how we are operating. So these initiatives are there, but we still, yes, have a long way to grow up the scale, but also educate and train government officials in government if we are running government systems and we are saying that we want to be artificial intelligence based. And for the health sector, of course, we are still suffering shortage of medical staff in various hospitals. But for us to improve the healthcare, incorporating ICT in our national, our security system improve. Today, I know we have CCTV cameras. There was an interesting question yesterday for the manifesto. One person asked, why is it that these CCTVs see big people, but you know, when a big person is stolen or something happens to them, the camera will bring evidence. When it is a small person, they say the cameras either were off or not working. Those are some of the allegations that were being made. But I believe that might not really be the case. But yes, those are some of the things that are being done to appreciate what government is doing to digitize. As I conclude, I would like to take a moment to express again my sincere appreciation to the researchers. Your groundbreaking AI has a solution for translating real time English into various, into various languages, local languages. I think the last time I engaged with them, you were at 7. Are you still at 7? 9 now. They were at 7, we are now at 9, but we need to get to 52 because Uganda has 52 different languages. And how best can you do that? If you did that for us now, as we are even moving into campaigns, you see the president is in Karamoja, is in Soroti, where that would be very helpful if we had that system in place. Also acknowledge this is going to grow bigger and will create. Let me wind by saying that that and prosperous Uganda. So we should all embrace it. And I hope and pray that the recommendations that we have here today are forwarded to the ministry as well, as we are developing our national artificial intelligence policy. I need us to incorporate all the conversations that we have had in this meeting. So we shall be able to sieve out what is policy related, what is strategy related, what is guideline related, and we incorporate all these things. And together we shall make this country a better place and an improved one. I thank you all for listening to me, and I say this for God and my country. Thank you. I'm being told I have to launch. I don't see a ribbon or a countdown. Are we launching with AI?
No, MICT had given us, but it was supposed to be, Minister of Health launched on the
Okay, I understand there was a launch earlier, but for me to re-emphasize the importance of the launch, I pray and hope that we have this as a sustainable conference. You know, in research they asked us, you know, what are you doing for sustainability? I hope this one has started and is going to stay, and you have all the support from government for this to happen. So I take this opportunity to officially once again declare this conference open. Thank you.
Thank you very much, our dear PS, Permanent Secretary to the Ministry of ICT and National Guidance. Just let's give a round of applause to her. Okay, no. So let's warm our hands properly. Okay, when I say 1, 2, and 3, you direct. Okay, let's now do it. Let's go. 1, 2, 3. Thank you very much, Madam PS, for your wonderful speech. I'm happy that she has re-echoed what we are supposed to do. Collaborate, partner, and continue co-designing. Hey, co-collaborate. Yeah, 30 minutes, because we need to finish the rest of the aspects. So I would like us to have a quick photo moment for just a few people that will be selected. Please do not say I did not select you. I would like to have Rose and team, especially this team on this table, come back in front with the PS for a picture moment. In the meantime, I would like to request other colleagues to start moving towards the dining area. Now, at the door, we are going to have some of our good ushers with meal cards. They will give you a meal card as which terrace? Which area? Lunch area? Okay, as that is being prepared, just yeah, downstairs? Yeah, downstairs. Okay. So get your coupon. Please, the Deputy Principal, College of Computing and team, please join. Our Ministry of Health, don't go away. WHO, please. Yes. Don't go away. WHO, please. Yes, Madam PS.
I'm new to this lab. This is our newest baby. So the lab.
One of our pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer. We want to be able to use diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
For the university, but for our entire nation, as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now, this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn.
One of our pillar projects is the ocular project, reduce time and improve accuracy. Pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Macquarie's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts, bringing together experts from...
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting. Ocular project, and this is a project that is funded by Google, and the work is really to
bring together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. For the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial
healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason d'etre for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research development.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now, this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
Development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now, this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy accuracy in disease diagnostics and specifically improve the way we use the with the key for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence. As the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a gender healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
Healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the
AI Health Lab will serve as a hub for interdisciplinary research, development, and health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcome, healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images to guide microscopists towards diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the
AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now, this is a journey that has just begun. We shall be reaching out to you, all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the
AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow.
One of our pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason d'etre for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
Welcome you to this lab. This is our newest baby. So the lab.
One of our pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our. We want to be able to use computer vision to analyze images, diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the
AI Health Lab will serve as a hub for interdisciplinary research, development.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the artificial intelligence.
My healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab.
One of our pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
By healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab is a very important facility for you to grow, learn, and nurture your academic talent.
One of our pillar projects is the Ocular project, and this is a project that is funded by Google. And the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and more accurate diagnosis of those diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerer's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab.
One of our pillar projects is the Ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use diseases.
There are extremely exciting opportunities. The technology has been maturing for a long time. There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from health.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab
One of our pillar projects is the ocular project, reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research.
So today is a very momentous occasion for me and for the country as we unveil the Artificial Intelligence Health Lab at Makerere University. This milestone signifies not just a step forward for the university, but for our entire nation as we enter an era of innovation and advancement in healthcare through artificial intelligence.
My outcry is now this is a journey that has just begun. We shall be reaching out to you all with one goal: to transform healthcare in our setting.
I want to welcome you to this lab. This is our newest baby. So the lab
One of our pillar projects is the ocular project, and this is a project that is funded by Google, and the work is really to come up with decision support tools that are able to reduce time and improve accuracy in disease diagnostics, and specifically to improve the way we use the microscopes, which is one of the key tools for diagnosis of some of our major diseases in our context, like malaria, cancer, tuberculosis. We want to be able to use computer vision to analyze images, to guide microscopists towards faster and diseases.
There are some challenges ahead. It's not easy. So we have to be careful when we build a system that we don't do more harm than good.
AI Lab is a game changer. It addresses the reason, the threat for Makerere's existence, as the motto says, we build the future.
The AI Health Lab will serve as a hub for interdisciplinary research, development, bringing together experts from fields as diverse as computer science, medicine, engineering, and public health.
So today is a very momentous occasion.
Respiratory infections. A telecommunications engineering graduate from Makerere University, and he has over 3 years of IT experience in the banking sector. His innovation, Mama Op, has won several prestigious awards, including ASME iShow in Kenya 2022 and Pitch at Palace Africa in 2017, and was a runner-up in the University of Berkeley's Big Ideas competition in 2016. Brian now serves as a judge and a mentor for various innovation competitions. Recognized goalkeeper by the Bill and Melinda Gates Foundation, he consults for governments, institutions, and private companies on designing and integrating software systems in health, agriculture, and energy sectors. Please allow me introduce Mr. Brian Turiavaje to come and address.
I'm happy to be here. like is mentioned, observed. And this afternoon, I will be taking you through part of the journey that we've been going through as Mama Op, so that maybe we can explain a bit of how we are using AI to make an impact into the communities. Thank you. You can put the next slide. All right, yeah, so Mama Op, our main aim is to address global child mortality and healthcare disparities. So a bit about us, we are a medical device company and we are illnesses. That's what we're looking at. So practically, my background is in engineering, and at the point when we started this, I must give you like a bit of a background. As we thought, what is the issue with these doctors if all of them are getting the disease wrong? Here the final issue is pneumonia. Why were they treating us? Why did this happen? Maybe this is an issue with child mortality is a bit high, especially with respiratory illnesses like pneumonia. For example, in Uganda, every 43 seconds, a child dies because of pneumonia due to the delayed access to treatment. So when you're in the treatment. But on top of that, we have a whole big issue of diagnostic variability, whereby if you go using a whole suite of the different tools we are designing. So what we decided to do, or what we started on, was to design different tools, starting with a hardware device. So what it does is that a doctor can use it. It's just mostly small, handheld. They can position it onto the different positions of the chest. And within a period of 1 minute, when it connects to the application, these patterns are sent to the app and it's able to interpret signs, especially depending on the vitals, which in this case would be the respiratory rate and also the lung sounds. But again, we've done a bit more work now to enhance this whole solution to say that on top of just getting the 2 vital signs, we want to be able to play along with the clinician when they're in their chest. And they also provide a decision support system, which leverages or maybe uses most of the local guidelines we have, like in Uganda, sort of like interpret or give guidance on what to do next. But even before that, it's sort of like prompts a basic doctor to ask more enhanced questions so that they're able to figure out more details of what kind of condition might be underlying with the kind of patient. So that's what we're doing. A digital stethoscope on those, which then work on the mobile end to be able to provide meaningful or maybe updated information to the users. When we were doing our clinical trials, that was last year, we noticed that quite a number of children, when they're being presented to a doctor, they tend to cry or they will be frightened because false signals, which is not recommended in practical medicine. The breathing rate, because at some point they have to be forced to first take care of it. If when they cough, when the doctor is trying to count the breathing, all kind of process, we are able to look, which shows like the breathing patterns as the high peaks, and then the whatever the inhale patterns. So we are able to detect within that particular signal when the child was breathing properly or when they had like a disturbance. So that at a point of being able to compute or to calculate the breathing rate, we look out for the patterns which are clean enough so that we are not exposing the doctor to the same issues which they had before they used our tool. Or a user has an option of turning a setting on whereby they can screen the recording for different abnormalities, as you can see like in the second screen. So as that option is on, whichever signal they've been able to get from the body, the application uses its algorithms to determine whether the particular abnormality is within the sound. But on top of that, it's able to display the breathing rate for this particular child so that it's an easy count for them. And then the third 2 vitals of pneumonia, we understand that doctors might be interested in how, let's say, the triage information informs the final outcome, like what kind of tests to do on top of what kind of recommendations they'll give to such a patient. So when we get the 2 vitals, or if they get them within the exams covering, especially like the Ugandan sector, so any query or maybe any kind of prompt that comes from the mobile app, e.g., if a patient came maybe with a breathing rate, different data sets that we have. So what we do is that these kinds of queries are sent to our large language model, which then processes the outputs and is able to offer a doctor either like an extended question, which could be in terms of maybe is this child having any kind of cough? Is the cough productive? Which covered about 5 different facilities and City of Science and Technology. In the development of this City of Science and Technology, in the development of this solution, definitely we were guided, partly part of the research is what we did from Makerere University through the guidance of some supervisors at the engineering school. And then previously we've had to partner with the Johns Hopkins University, which had done a whole big study on over 5,000 patients, both from the lung sound interpretation side, but also from the clinical outcomes, because they covered quite an array of different stages of the whole process of setting up our quality management systems as to what you see there as ISO. So basically what we've been doing is to try and set up our processes we're trying to do. And also with the participation into the Halcyon program, which is based in Washington, we were able to gain entry and access into the people from the FDA, putting us in terms of being able to prepare us for the final clearance process by telling us which kind of technical things we have to hit, or technical milestones, so that a solution can be approved, piloting and also validating a solution from there. We've also been supported by the Science for Africa Foundation, especially with the development of the AI for the clinical decision support into this whole process, into the kind of communities, especially like in Uganda, but also in the other areas where we've been accepted.
Thank you, Mr. Brian. That wonderful presentation. Appreciate you. Let's give him another round of applause. And thank you for keeping time. So the next sessions, we shall ensure that we also keep time so that we don't, So we're going to have a panel, and I'm going to call these panelists to just follow me quick. Please, when I call your name, please just come over and we have a quick discussion. Ms. Sylvia Nabukenya from IDI. Tony Okech. Tony Okech, is he around? Chagara Emma. You're welcome, sir. Solomon Muhumuza. Solomon? All right. In regard to interactive, it's going to be an interactive session. We want to look at the challenges, the ethical challenges, and what are the best practices for developing and implementing AI in healthcare. So at this moment, I would like to open the floor to our panelists to introduce themselves real quick. I'll go first. Call me Eugene Miheso Sinoston. I'm going to be the moderator of this session. And an ardent follower and enthusiast in the AI world. I love IT and AI lab and AI health lab, all of them, that is part of my family. I've grown up there. I was nurtured by Dr. Ernest, and I've been there and worked there with Pius, Solomon, Dr. Rose herself, Dr. Godliver. Yeah, so it's more like home. So I'm glad to also be here to support the process and be part of this wonderful panel session. So over to you, sir.
Mic check, mic check. Good afternoon to you all. I think it's the tradition of, thank you. Good afternoon to you all. My name is Muhumuza Solomon. I work with Ministry of Health in the Division of Health Information. I'm the data governance and security specialist. I know governance is such a big word. You could be wondering what I do exactly. Is one, ensure that we have appropriate governance structures in place, structures that discuss, for example, issues of AI in health, issues of innovations, discuss frameworks to be able to guide implementation of digital health. But I'm also the secretary to the Health Information, Innovation and Research Technical Working Group, which is an interface for Ministry of Health to get expertise from academia, from different partners, to be able to feed into Ministry of Health policies, the agenda, and be able to influence the Ministry of Health strategy. Glad to be here.
Thank you very much.
Yes, good afternoon.
Good afternoon, sir.
I'm Emmanuel Chagara, the CEO of Milima Security, a member of the National Information, and I'm also a member of the European Union CyberNet program. It's an expert pool of cybersecurity around ethical AI, which is something that specifically many of the things that they're doing. So it's a very exciting opportunity. I thank you, and I look forward to a very great discussion.
Thank you very much, Mr. Emma.
I hope I'm audible enough. Good afternoon to you all. I'm Dr. Tony Okecha, and by profession I am a medical doctor with over 10 years experience, 4 of which have been as a specialist pathologist. Do lecture at Makerere, and definitely I'm also glad to be here. Thank you.
Thank you very much, Dr. Okech. Over to you.
Okay. Good afternoon, everyone. Sylvia Napkenya is my name. I am the Senior Regulatory and Compliance Officer at the Infectious Diseases Institute, which is also a partner with some of the projects in PhD Fellow in Bioethics, and I have a growing passion for ethics in AI.
Thank you very much. So, my panelists, let's ensure we keep time like Sylvia. Yes, quick of questions that I can ask, ranging from security, regulation, and so on and so forth. But I don't want to bore you with my asking. I would like to open the floor to the public, and we hear from several of you. I'll request the panelists, we take note of the questions, and then we shall respond to them. So we have a hand up from, yes. Please introduce yourself before the question.
Yes, thank you so much. My name is Katerega Michael. I'm a medical doctor and a student of Masters in Health Informatics. So my question is, we have developed a model and we have tested it, and it is working perfectly, but it makes an error and the patient dies. Whom do we blame? The person running the model is maybe a medical doctor. The person who developed it comes from courses. Whom do we blame? Thank you.
Okay, very interesting question. Hopefully our panelists are taking note of those questions. Okay, can we please have the next question? We have, yes.
Thank you, panelists. Thank you, the moderator. My name is Mark Oteke. I'm from the College of Health Sciences, School of Public Health. This question could discuss governance structures that allow us access to health, to explain the processes that are required to access this data, ensure its ethical use, and also the return of. Thank you very much.
Thank you. That's a very good question, sir. We appreciate it. Next question.
My name is Nasa Chimbu. Doctor, what exactly causes cancer?
That's a very good
looks
question.
Like everywhere you go is cancer. Don't drink this, don't drive this, don't put your phone in your pocket.
Another, okay, we have another one.
Thank you for the invitation to this important conference. My name is Patricia Nahiri Antege from Bela, Uganda. And this question goes to Sylvia, being a senior regulatory officer. The role of the community in AI, what have you done about it on the ethical level? How have you addressed the cultural differences? What language are you using? Because the issue is, how do they understand such a complicated but very important topic at their level? Thank you.
Okay, let's now take the last question.
Yes, hello. Ms. Lwasampija Baker. My question is to the Cyber Security Bank of Uganda incident that we have, so giving specific examples. Thank you.
Thank you for all those questions. And on, the models tested, if there's an error and a patient dies, who is to be blamed? Is it the doctor, or is it the person who developed the model? I don't know. This, I think, is open. This question is open to any one of us.
I think I will submit to that. Dr. Michael, who asked the question, is definitely running direct to either the doctor or the patient. But honestly, if it is a case where we need we need some legal interpretation. There has to be some due diligence done in terms of investigating, what could have been the cause of death. Maybe it's not even the model or the technology to start with. But if that has been taken care of, I think as a country and as the previous speakers who have been here speaking, as Ministry of Health, we don't have guidelines on the implementation of AI in health. And that's why, the colleagues I think from Rocket Health mentioned that in the health sector, we kind of go slow on technologies to avoid such scenarios, because we would want to have thought out all this and guided in the instance that, for example, the investigations have been done, maybe you come down to the model. Is it the technology provider that you have to blame? So I think as we continue these discussions, as Minister of Health, to be able to these specific use cases of such technology. Over.
Okay, thank you very much for that precise answer. But I think we still need to answer this question. I think you ran away from it, but we need to get an answer, because it is something that is due to happen. It might happen, but we still need to come with a solution that can actually resolve it from this discussion. So, yeah.
Yeah, I think it's also, I just want to, can you hear me?
Try. Yeah.
Okay. When we ask such questions, we forget one very foundational principle. Technology is an enabler. Technology has never been and should never substitute human intelligence. Whether be it in artificial intelligence, whether be it use of basic smartphone, that rule applies. So when it comes to diagnosis, we are looking at using technology, and first put aside the word AI, using technology to diagnose something, and then eventually the result is what you work with, the technology. Was it a trained doctor? You see that? So we should never think that technology is because humans must always stay superior, and that's a fact. So we cannot choose to blame technology over the doctor who worked on it. Even as we are discussing the advent of AI, we're talking about our responsibilities to technology. We must stay accountable over and above any form of technology that comes.
Some people worry that AI will replace doctors. I'm pretty savvy in writing for the doctors, right? Yeah? Yeah, so, we still have somewhere to go. A space where Professor Tony Oyana talked about validation, tests, all those things. I think by the time we are actually deploying a technology, we need to be in a position to defend what the technology has done, but the human that actually is able to prescribe and diagnose with regard to what the technology has given to them. So, Dr. Michael, I think we have put your question to rest nicely, and we can move to the next question. The next question was about to the Ministry of Health. Yes.
Yes, Otega, thank you for that question. One of digital health guidelines, sharing and use guidelines, and also there is another guideline there for health data protection, privacy, and confidentiality. But to just speak to your question, in that particular set of guidelines, if you'd need, for example, data from Ministry of Health, even if it is data within health facilities, you have to write to Ministry of Health officially. That is why you want that data. If you look at those specific guidelines, they have a data sharing template at the bottom, which would feel appropriately to be able to get this particular data set. Definitely on our end, we would be able to review if the request is reasonable. For example, last week we had a request for someone who was asking for all the data we have in the EMR, all of it. Of course, that is not reasonable. You've not specified the date, which year, which month, which disease are you looking at. And definitely there is PII data in terms of, personal identification, and we have share, once approved, to be able to securely share this data that is needed. But I implore you, just Google, you should be able to download that compendium, and you'll jump to the health data access sharing and use guidelines. Thank you.
Okay, thank you very much. And I think that's it for that question. Just a small note to make. I think 1 week ago, we were in a validation workshop for the National Data Strategy. And of course, as this is being compiled and being put into place, there will be, of course, mechanisms. And of course, there are those lacuna areas, for instance. So Dr. Ernest in the morning reflected on the same thing. You know, getting data even from somebody around you, they have already put in the effort and things like that also takes a process. So there must be those checks and balances, what is public, what is not public, and all those things. And like my colleague has said, so I think well done, sir. Thank you for that answer. And I think, Michael, that was a good answer for you. So we're going to move to the next question quickly. And this question was from Mr. Nasa Chimbugwe. And this question goes directly to Dr. Okech. What causes cancer?
Thank you very much for that question. So, unlike other diseases, cancer is multifactorial, and we have lung cancer. Another one could have cervical cancer, and you may find that the different causes for those different cancers effective. For example, you could go and do a PSA. However, that is not going to save you from probably getting a leukemia. You may do a colon, going to help you in probably screen causes of cancer and some unknown causes of cancer. As far as the known cancers, rather the known causes of cancer are concerned, we usually group them into different parameters. And for example, we could have the physical factors. And that's now going to encompass things like, for example, exposure to radiation. We all know what happened after the Hiroshima and Nagasaki bombings. Most of the people who survived actually did develop leukemias. So that can directly be tied to be a causative for the different cancers that evolved. It wasn't only just the leukemias, but people developed physical causes, be viral. Hepatitis B. We all know that hepatitis B is really associated with hepatocellular carcinoma. They're usually given treatment. In addition, we have the HPV type of cancer. So right now what we are doing is that we are screening women for HPV, and those who are positive, even though causes of the cancers that are, but people usually inherit these. Some particular cancers actually do run in families. I'll give you an example of the BRCA1 gene. So people usually have the BRCA1 gene are usually prone to developing breast cancers, prostate cancer. It was like in the BRCA1 cancer, but because she had that mutation developed, she actually went and had these chemicals. Now, cancers. So it is still out there. For the most of the cancers, actually, the cause is not known. It's only so that we can avoid these preventable cancers. Thank you.
I'm sure if we continue this conversation, the CR1G to actually get to know what are these causes. It's something that we just talked about, but it was a very good question. What are the causes? Maybe doctor, you might just want to shoot out there.
Emphasis should be placed on the cancers that are, cancers in Uganda are treatable cancers. Now the treatment, a very, very good chance of examinations for the ladies, and also you go for a mammography, okay? These are very cheap tests and actually do. And also HPV are the ones that even before they develop the cervical cancer, that others are offered leave. Colon cancer, usually we go and do the lumen of the colon. It's usually a tube that they just pull anyone who is 50 years and up. So these are screening tests or further tests like bio.
Thank you, sir. That discussion is really good. Why? Right now, the AI Health Lab, and I'm sure Uganda Cancer Institute, but especially the treatable cancers. Yeah. Okay, our second last question is, and the question was regarding the role of community in this AI ecosystem. Over to you, Sylvia.
Thank you so much, moderator, and thank you so much, Patricia, for that question. So, understand what AI is. And like we had earlier mentioned in the beginning, that AI is still new to most of us, yet we actually use AI, interestingly, in one way or another, with the gadgets that we have here. And what could actually come to mind when we talk about how can we have effective community engagement? How do we bring everyone on board to understand what AI is, what AI can do, and how we can utilize AI to solve health-related challenges? And what actually, one of the things that come to mind is how well do we promote effective community engagement? One of them could be, how do we convey the information about AI to the community and to the public in other research settings, other use of the community advisory boards, the community champions, but then also coming up with some approaches like drama, where people, someone of a layman person can actually understand and appreciate what you're talking about. And this is basically something important for people, for the public to appreciate, because as we think different literacy levels, and so if we don't explain this AI in the simplest manner possible, how do we get people to use the products that we make? So I think one of the things we need to do is to emphasize the fact that we need to communicate AI-related information in the simplest manner possible, engage various key stakeholders as much as we can, and then also put their needs to the forefront. But also one other special thing that I know about community engagement is trying to first understand what exactly the community knows about what you're trying to tell them. It will be important to do some empirical studies to understand what are the things that people think about when you say AI is here trying to give you, how well can we correct any misconceptions, or how well can we emphasize what we need to emphasize. So I think that's what I could say for now.
Thank you. And as usual, precise. Thank you very much. Question is to you, Mr. Emma. And it was regarding with our learnings from an instance like what has happened to BOU. So I'm sure we are in that space right now where we are in that digital space, and one of the key issues we are facing is on security. Just regarding such scenario, and what are the learnings?
Thank you very much. It's unfortunate that we have to use the BO scenario, but I mean, that's the truth. That is the world we are living in, and it's something that we should become very mindful of. When we talk about cyber threats, for a very long time, the idea has been that it's a very far-fetched problem. Maybe it is only in American movies. You probably will not relate with me. But as we advance in technology and as we encounter all of these emerging technologies, it's also very important that we now recognize that the threats are here with us, and any one of us could be a victim. The BOU case that has come out to light happened maybe about look at. First of all, when we go back to the foundational principles, any technology that we're building should be secured from three. These things are very essential for any security infrastructure. Many times when we think about cybersecurity, the quick thing to think about is, oh, have we bought the best firewalls? Do we have antiviruses? Have we audited our AI models? And all that stuff. Error attributes for up to. So when you're able to address the human error, you have reduced your risk by up to 85. So you only have 15 to worry about. Now, when we talk about the human error, we're talking about people like us. When Doctor was talking, I rarely sit in a room where I'm seeing stars, but today I was seeing stars. Now, when we're using technology, some of you also see stars. But you shouldn't forget that you're a user, and you must know how it works. You must know the risks. You must know what it means for you, whether you are not a computer science person. All right? That's a very foundational issue. But then cutting across the entire human element, we're talking about the people who are building the systems. Many of us do not have policies and procedures in place for how we use our technologies. So often a cyber attack will happen not because there was a weakness in the infrastructure, but because there was a poor policy on, say, response. Okay? Something as basic as saying all our infrastructure should have 24/7 monitoring, such that in the event of a breach, we can have a near real-time response. That guarantees you a minimal level of impact and most probably not going to lose 60 billion. You see that? These are issues around policies and procedures. You don't have antiviruses, you don't have updated software, you don't have anti-ransomware tools. These things come back to bite us. Someone would think, well, I think BOU must have had all of that. You don't know for sure. You see that? Sometimes you see weaknesses. Now, Windows XP, any of you will know it was a long, abandoned operating system. It was nice in our days, but it's not nice. So, lessons from it. We come back even to our AI models. We look at some of the risks that we are facing with bad models, with bad data, which is leading to bias, and all of these errors that eventually lead to vulnerabilities in our systems. Artificial intelligence, just like any other form of technology, is hackable, but it can be addressed when we look at these key controls in place.
Let's given a good response. There are things we have addressed, but we could not be in position to really sum it up all because of the time constraint that we have on our hands. Please give it up for our wonderful panelists. We are now going to have a photo moment. After that photo moment, we are going to be inviting, I don't know if my team is ready with the presentation from Caitlin Kraft. Is she ready? So she's not ready. So we welcome Professor. Okay, perfect. So after the photo session, we are going to have Professor come on. So. Okay, thank you very much, my wonderful panel. And we would like to now go to our next speaker at Makerere University challenges. At Makerere University challenges, particularly in developing countries. He leads developing countries. He leads projects that utilize is also developing a multi and power outages. In computer science from I don't know what I'm going to say. Université Brussels in Belgium, and first class honors degree from Makerere Université Brussels in Belgium, and first class honors degree from Makerere University, where he received a top professor engineer by Nomugisha.
I was a bit worried that my presentation is going to come a bit later, so thanks for managing the time very well. I have it on my phone, but I cannot, I think, do a... I have to say that, yeah, in terms of the strategies, this is one of the efforts. So what I was asked to talk about, in a way, is already being, that's already ongoing in the government as well as in academics. So there's been a lot of focus on health more generally. So it means that I'll try to speak about, you know, how do we grow AI capacity beyond highlight a few strategies that we can look at for building AI capacity in Africa. So, does this work? Okay, great. And where's the receiver station? Over here or here? Okay. Great. Yeah, thanks. So just to really kick it off, I think what is really important when you talk about developing, so why should we be looking at developing, talent and skilling in AI? Or we can also add data science. Because I think so. What we have seen here, if you look at it, to many patients, particularly in the context that we work in here, because some of these challenges that we see, areas, I think the cases that we are being referred to here on AI could have used AI to predict and forecast that fraud was likely to happen before the transaction was approved. To see that we can expand and kind of leverage this potential of AI on the continent. From PwC study, which is really a global landscape, up to 25% increase in terms of the wages for AI. So again here, when you're looking at AI, we're not really trying to meet the capacity of AI, like Africa also position itself in this big economy that's growing worldwide. I spent a bit of time, trying to think about, this, and my position, look at the positioning of or Uganda as a consumer, largely developed elsewhere, but we can use it in paying much attention in terms of how we can develop AI. That's one extreme. The other extreme is that we can also position AI as a creator of, we can position Africa as a creator of AI, technology. So that means we are investing really in research and education to actually ensure that Africa can participate not only in consuming AI, but also developing AI. If I may ask in the room, where would you both? Yeah, I think the good answer here is that we actually need to balance these two aspects, because as the PS was saying earlier, we have to also be able to be trained on actually understand what AI can do for us. If we are interfacing with AI on a day-to-day basis, this might be the public. About 20 years ago, or maybe 25 years ago, when you would tell anyone that you would at one moment move with a chip in your pocket and go to the bank and get money, what do they think? They will think it is satanic. Implants, that you can now have a chip within your body and go, you don't need an ATM card. Now people also start questioning that. But since we have made the progress, with the previous use cases, I don't think we are very far from that kind of technology. But anyway, so just to say that I think Africa, we need to find where do we optimally position ourselves? So how do we balance, this? And is that the end of the slides? Maybe not. Great. Yeah, so what does it mean if, depending on where we position Africa or Uganda, what does that actually mean? Where should we focus our efforts? What does it require to actually contribute to this, idea of developing talent and skilling? So again, here broadly, if you look at positioning, Uganda or Africa as a consumer of AI, we need to invest in AI and digital literacy. So people need to understand how to use AI. They need to understand what are the risks, what they can do with it, how do they use it safely, responsibly, and all those things. We can also invest in terms of training, people to actually do management of AI systems. So management and maintenance of AI systems. So this is, one extreme. And the other extreme in terms of the skills that we need, then we need to invest in, AI development, as well as, training in AI research and innovation. I think alongside the AI and research and innovation, that we also need to grow the AI industry. So not only, looking at AI in the research, but in the private sector and the industry, is AI being considered as a priority? And we see startups and companies looking at, AI or utilizing AI, because it will be very difficult to do this skilling if we don't have many use cases in academia, outside academia, and in government. I need to figure out how this works, but I guess I need to press like 10 times, and then the 11th it will work. Okay. Great. Yeah, so I've talked about, how do we position Africa in terms of, two extremes. As a consumer, as a creator, and what kind of skills that we need to do. So what I want to be a consumer of AI, what strategies do we put in place to actually develop the talent and the skills required? Stream end, the fast food education model, well, this really picks the name from, like the fast foods. If you are hungry, you have maybe two choices. You can decide to go and buy fries or chips. And this will, get you up and running quickly. But you can also decide to go and prepare matoke, but maybe it's going to take you a bit of time. So again, when it comes to AI space, where do we want to position Uganda? So the fast food model has its advantages in that it can actually give us quicker gains, because now the world is really moving. As you know, technology is moving very, very fast. Maybe 1.5 years ago, we did not have ChatGPT. Now we have it. And people are using it. Or, if you are from academia, maybe you are now looking at dissertations generated partly by AI. So how do you ensure that we are actually building capacity? If you're in the health sector and so on, you are generating reports using AI. How do you ensure that that happens? Maybe for that to happen, we need to adopt partly the fast food model, which is that we prioritize speed over depth. So this has the advantage, lack the depth, but because also the technology is moving very, very fast, we are likely to be outdated. You get a skill today, in 6 months, you need to go back to school. So do we want to go the fast food model or not? The other extreme is a traditional education model. I come from the university, so I will not try to advocate for the traditional education model, which I think is partly outdated, because one of the things I've been trying to investigate is how do we strike a balance between these two models. We can deliver education that's fast enough, but it also has a sufficient depth and breadth. Things like traditional diploma programs or integrating AI education in high school and primary schools and so on. But this is going to take some time to give us results. If someone is taking a 4-year program at the university, they will not get ready at the end of 1 or 6 months. It will take a bit of time and also keep up with the change, and they will also get to learn much more than just AI, because it's not just learning how to do the right machine learning model, but there are many other aspects like ethics, as the panel was talking about. So to be able to embed that in education model are things like you can run a boot camp. You see sometimes someone has done 1 weekend boot camp and they come back and say, I'm an AI expert. 1 week and they come back and they say that they are AI experts. Again, here also being able to carry, maybe if we are looking at already in the workforce, but if you're looking at the long-term pipeline for the country, 20 years, 10 years from now, then maybe we need to invest in how to improve our traditional education system. I think I should go back. Okay. Wow. Yeah, I will just do maybe two more slides, and then I will conclude. Just to say that I think as we're looking at developing AI talent on the continent, I think one thing we have to know is that we actually have to deeply engage and collaborate with the different stakeholders, understand what are the critical needs of AI in different sectors. In 2021, we did this analysis. We had a workshop on AI skills analysis. This was a workshop done by Data Science Africa, Uganda. We did this together with GIZ, Ministry of ICT, and other stakeholders. And there are some of the things that came, through the the discussion. Trying to see if you have policymakers, if you have developers, if you have managers, what kind of AI skills do they actually think they need most. I will not try to enumerate each of these, but just to say that these are some of the options available to us if we actually need to deliver on those skills. On one hand, the traditional program curriculum designed 4-year, 3-year, 5-year program has the sufficient vertical depth, but might take longer to deliver, but also providers can run like summer school. Again, time when we did the analysis, we worked with the Ministry of ICT. We came up with a short professional program on AI skilling. And I think we had about 80 professionals from the government and other sectors that were trained through this, together with the Ministry of ICT, GIZ, and was run under Refactory Uganda. So I want to conclude here. I think I've run out of time. One of the things I was told is that once you see the modulator moving closer to you, you know that you're running out of time. But just to say that to deliver on all this, it's important that we also focus on the delivery or the strategy, ensure that the delivery is done in close collaboration with the industry, but also puts a lot of emphasis on what use cases of AI we actually have in our context. And thanks to this conference, we already see a lot of examples on what AI can do in the health sector. And hopefully we can do the same, grow the AI talent and the capacity on the continent. Thank you.
Presentation, we can talk about everything, but if we don't have the capacity, it's not going to work. Thank you for that enabler in ensuring that we can ecosystem. Right now, without wasting a lot of time, I would like to invite Caitlin Kraft, founder. Buchanan. She's the CEO and founder of Women at the Table, Gender Equality and Systems Change NGO, and think tank based in Geneva. She's a co-founder and a leader of the A+ Alliance for Inclusive Algorithms, a global coalition prototyping a new future of AI, and a leader of AI and Equality Human Rights Toolbox Initiative, a platform that supports a global community working for human rights-based approach to AI and consulting with organizations and corporations on methodology and technology, products that work for the triple bottom line. Experts for UN Secretary General's AI Working Group, a member of the Gender Advisory Group of the AI Action Summit to be held in Paris in February, and co-chair of the UN Commission on Science and Technology for Development Gender Advisory Board. Caitlin, you're welcome.
Thank you so much. Thank you so much. Thank you so much for inviting me. It's really a pleasure and an honor to be here. And forgive me, I had a little bit of a time mix-up, so I'm talking to you from the basement of the on business and human. The vast majority of these are still the default for research because we haven't figured out the estrus cycle. And what does that mean? It means that currently many diseases, and they are diagnosed 4 years later on average than men across 700 and years later on average than men across 707. No aggressive treatment plan when they're sent back. Even treatment plan when they're sent back. Even when they're diagnosed correctly, are often this notion self who have never been, in these clinical process of creating these drugs and these medicines. As a matter of fact, less than, I thought it was 3%, but it turns out that it's less than 2%. Of the the place where all human life began. Experience is going back to the research on women. We know that researchers have identified 86 drugs with clear evidence that women metabolize these drugs more slowly than men. And in 96% of these cases, this led to higher drug. And in 96% of these cases, this led to higher drug exposure and often a great likelihood of adverse breast cancer. That the current mammograms that we have, are often really doesn't work for like your health area. You're going to be able to potentially use the incredible innovations that you've come up with in Uganda, like the 3D printer that the health lab came up with that attaches to the microscope. That is something that attaches to the microscope. That is something that's it's a knowledge opportunity. It's a knowledge opportunity, and it's a trade opportunity. The trade ambassador from Sweden once told me that their two biggest exports are, one is mining, which I didn't know about, but the other is music, because they have Spotify, but they have all of those record producers that produce kind of pop hits. And there is that kind of trade opportunity in health, I think, when people have come up with very localized, very community-based solutions, that they have the answers to that are so specific to the context that they are so specific to the context that they actually become best. There's an opportunity for the great thinkers, the great innovators to leapfrog over this old-fashioned medicine. Not only 19, like a very tiny deficit weight, which is what all the dosing, your citizen brothers and sisters, but really go throughout not only Africa, not only throughout the global South, but I think share with you today. Thank you. I'll come back and talk more. In the House, and export this extraordinary animation that really comes out of disconnect with the data, capture data, and then age. And I think that and have the data, you do good public health, really diseases come from. And it would really be a shame in wherever it's used, but for example, on women, because we don't know how anything affects women at all. So this could be the beginning of a really new science where we start to see that born diseases that would be very interesting information to have, and I would think crucial information to have from a public health.
And we just love the fact that you can bring it out as it is. And thank you for representing the women at the UN. What you're doing is really commendable. So I'm going to take 2 questions for you. Then we see how we can, you can just class. Everything was just straight to the point. The point has been driven home. And we'd like to thank you very much for that wonderful presentation. Thank you very much, Caitlin. All right, we are now going to move their children from school, others, all kind of things. So we're going to go into a brainstorming session. We're gonna also minimize the time on this particular aspect. We would like to focus on the call to action points, health sector. Anyone willing to contribute? Yes, we have Michael. Willing to contribute? Yes, we have Michael.
We have a new thing, and that to people above to people above in academic. We face a challenge of data, as my colleague said. People collecting, they have still to AI at RB if it does not directly involve human subjects. For us students, we are facing such a challenge because we have to be subject. Thank you.
Not so what is being said.
Potential dangers, risks in this AI baby, and how ready are governments and scientists to overcome in any case if there are serious dangers. Thank you very much.
Here, who can also respond to that particular question. Do we have any other contribution? We still have more 6 minutes.
Everyday challenge of data that apply to us in the cases where they need to. Thank you.
Month ago, and so still dealing with an imperial, dealing with data that is actually still over question. But into this one, yeah. So
I think you called it,
yeah. So
I think you called it colonial data. Yeah, I think that, yeah, there's, as you, but I think, yeah, I think that, yeah, there's, as you, but I think systems where the it fits, but I think systems where the it fits partly on the continent, systems where the it fits partly on the continent is on the continent is, but we're also positioned for it is, but we're also positioned for initiatives going on, either looking, but we're also positioned for initiatives going on, either looking at specific sectors like initiatives going on, either looking at specific sectors like either want to improve service data is maintained and is also continuously adding value to the service delivery, to the service delivery. So data collection not the end to the service delivery. So data collection not the end, but also define to the delivery. So data collection not the end, but also define to the journalist has opportunities and risks. Sometimes talk about the opportunities, so thanks. Has opportunities and risks. Sometimes talk about the opportunities, so thanks for the question. Talk about the opportunities, so thanks for the question. To also actually highlight, the risks. I think like any other technology that you might have, you find that you know, cars came with a lot of value, but also they came with many risks, like accidents and all those kind of things. And the same with AI, bad use. So there are many risks. If you are in the, like in the health sector, what we are looking at is that, for instance, the risk of, that's already a risk. There's a risk of misuse. Suppose you build an AI tool to be able to, classify, tracks, privacy and so on. Now, of exclusion to digital technology. But still, briefly to speak to the question, I think by Michael on the data and IRB. I think people from the ethics side will speak more to that. But my interface with IRBs is that they have told me that actually it's not up to you to determine whether your work is IRB exempt or not. It's the duty of IRB board also tell you what is exempt or not. You cannot just say, okay, my work will not involve human subjects and therefore I'm exempt. You should subject your work to IRB. I think that's also what to actually ensure that we can have responsible and safe AI systems. Earlier on, I think I had a discussion, with the PS, and she did mention that one of the things she's trying to push under the national data strategy is to see that they can actually to open this. and available for researchers. So we hope through those initiatives we can also be able to open up the space. But that said, I'm for open data and open access, because the only way, just to close it off, we can say that, data is as valuable as accessible. Thank you.
Thank you very much, Prof, for that response. I think we are also getting some good knowledge from here. Maybe I can take the last two questions. Success.
Yeah, thank you very much. Good evening, good afternoon, everyone. Yes, my name is Success Kamhanda. I'm a master's student at the School of Public Health doing health informatics. Mine is a point about generalizability of whatever we are developing with AI. I was, as well as researching about, I met an interesting model that was developed at MIT that has the capability to predict lung cancer up to 6 years up front. But the limitation they mentioned was, no, you can't use this elsewhere because we trained a model on this data set. So how do you overcome that challenge? And I think this would be a good brainstorming session for that. The other point or the other concern I had was about clinical integration. Yes, we're probably developing this, and this moves hand in hand with advocacy. We are developing the models, but how do we integrate them into the look at health information systems that have been developed, but the adoption rate is still low, even in Uganda. Now we are bringing in AI systems, and which I think are not so different from the HIS or the health information systems, and these ones are even worse because some of the people think, oh my God, these ones are here to take our jobs. So yeah, how do we tackle that issue of advocacy and clinical integration? Yeah, thank you.
Okay. Answering or a question? Question?
Thank you very much. Okay. My name is Paul Mbavu. I work with Mackay University Lung Institute, and I'm a data manager. So my question will rotate around the data collection. You find that in most cases, the studies that are granted, they keep on collecting data, which is actually supposed to inform the objectives that have been set out in such studies. And then here you come, we normally forget about the future use for the data that has been collected. And by the time someone comes requesting for data from a certain study or a certain research, you find that the data that has been collected in that study cannot inform any of the objectives that have been set out by this other study, which is going to use AI-driven approaches. So my question here, especially to Dr. Nakasi, is that how are they handling the retrospective kind of data collection whereby studies with data do not have the AI approach being embedded into the data collection activities? Then the other question, maybe still to Dr. Nakasi, is that I understand that ML driven approaches like this are normally data intensive, meaning that if a disease like maybe bilharzia has not been studied or has been neglected, it means that its application or application of AI in such diseases is a bit a challenge. So what are we doing for the neglected diseases?
Okay, thank you. Mine may be a bit abstract, and it goes mainly to the researchers in the house. Yeah, as it has been said, AI, just like any other technology, comes with the potential risks. And linking this to health, I would like to know what role AI has played in areas of bioterrorism. Thank you.
Okay, we need to keep this short. Okay. Is it a short question? Short. Okay.
Good afternoon, members. My name is Mandela. I'm a Chief Operation Officer for TUI App. My question is so brief. As we are developing all these models, we have to take in considerations. Are we making them open source or closed source? You know, the countries that develop some of these high-end technologies, most of them, by the end of the day, their goal is to make money. And so, have we also put that as one of our main aim? Because we can develop all these technologies, but to sustain them, we really have to monetize them and make money out of them.
Okay. Mandela said short, but it was long. So I need it short.
Hi everyone, I'm called Philo. I'll make it short. Mine is about inclusivity, and I'm just curious to the practitioners here and the researchers, how do you really ensure that gender is really being included in your research and in AI currently? Thank you.
Okay, that was indeed short.
Hello, my name is Johnson. Mine goes to Mr. Chagara Emma. I wanted him to tell us how did the people in European Union use tech solutions to monitor corruption.
Interesting. Mr. Trump Pence. Yeah. So I think we have, those are enough questions for today. So I really need willing parties. I'm sure we have a question to Dr. Rose. I'm sure Pius can take one or two. I'm sure we have a question direct to Emma. So let me start with Emma. Let's keep it short.
Some of these questions deserve awards also. How is the European Union doing what? Using AI to monitor corruption, inefficiencies such as corruption. Basically, we are talking about collecting vast amounts of data to enhance governance, okay? Corruption is a very broad problem in our society. It could be based on racial segregation. It could be based on blocking access to services. It could be based on failure to deliver government services. All of these are aspects of corruption. And even if we're talking about the European Union or bringing out down here to our own government, there are so many opportunities for us to leverage artificial intelligence to minimize decisions that could otherwise lead to a corruption approach in terms of service delivery. Now, we're already dealing with vast amounts of data. Let's just talk about a basic example, say, in terms of access to services. When one person goes to access a loan facility, what are the decisions that are made to help that person access a loan? It could be based on their financial records, the transactions in the bank account, but there are certain silent decision-making processes like skin color, like the highest academic qualification, sometimes even the region where this person comes from, okay? All of these are aspects of decision-making that help influence whether or not someone would access such a service like a loan. Now, if we take on this very scenario into artificial intelligence, which is, say, relying on 50,000 past records, then we aggregate and realize that, oh, so it turns out that when someone is from this region of the country, they are more likely to qualify for a loan as opposed to someone from another region of the country. Not because this one has not met the basic criteria for access, but because they just simply come from a wrong region. That's the beginning of corruption, isn't it?
and that is enabled using AI. So AI will not make it easy for you if you put in bad data. You understand? So we have to be conscious of how much the quality of the data that we're putting in and all of that. So bringing it back to addressing blocking corruption would then mean we also have to be mindful of our data collection criteria, of the quality of the data input, because this is how we can then create a more leveled governance, and then we avoid all the impacts of corruption. Thank you.
A very good diplomatic answer. Is there anything you would like to speak on? Okay, it seems so.
Oh, okay. All right, thanks. So I'll try to speak to two things. One, the bioterrorism issue, and the decolonization issue. So, yes, my name is Pius Magaga. I do several things, but generally I'm a data engineer. I do part-time lecture at Makerere in embedded systems. Yes, I do work on some projects as well, particularly the air count project. So from two perspectives, one as the protagonist and two as the antagonist. So as the protagonist, for example, please do not quote me on this, even though you're filming me. It is, when we look at genetics, for example, there was Dr. Tony, I think, was talking about cancers. So it is possible to design bioagents that are customized to a particular group of people. If you know certain predispositions, for example, that people from a given tribe react to milk in a certain way. So someone can use that information to develop agents that can then be distributed through very basic things like a food item that those group of people like. Some of us like nuts, and before you know it, a whole population of people has been compromised in one or the other. And so AI is something that can really enhance such bioagent designs tremendously, because it can sift through a lot of data very quickly, and we can use it for things like drug discovery, as we have recently seen with AlphaFold and so on. But on the other side, the example that there was someone who gave a keynote earlier on from the Ministry of Health, and he mentioned the issue of Orange, when people were gassed, for example, into sleeping, and they wiped out the whole place. So AI is a non-biological thing, so it stands to be more resistant to biological agents that are used to incapacitate people. So, for example, human beings, and like Mr. Gachar, at times the biggest risk component in any system is usually the human factor. So most people, when they are looking to bridge security, they will focus a lot on the human factor. So AI is something that can stand in that gap, something that can be able to assess a lot of data to identify potential risks before they even happen. And this work of Ocular, for example, if scaled up properly according to the theoretical designs and hypotheses the team has had over the years has the potential to identify some of these risks that could be biological agents in nature, such as mutations, for example, happening in one population, drug resistance happening in a given population because maybe there is some issue there, and maybe some malaria drug, for example, is not having good effect. So we could use AI combined with surveillance of a lot of data to be able to identify some of these risks across the board. So for the case of medicine, for the case of actual security systems where you have hermetically sealed rooms and so on, like for air cleaning. Now, just to briefly, we're at the cusp of being able to contribute on the global stage as Africa, and but looking at how to improve and to also make what is of us. So some of the challenges we have here are a good opportunity for us to innovate. So the lack of energy, the lack of money is a good opportunity for us to innovate in terms of frugal systems. That is AI and any other form of technology. So how do we design language models that are not large in nature, language models that do not require a nuclear reactor to operate? Can we run high computer HPCs using solar and deployed out in the open without extra need of cooling? Such things. Yeah. Thank you.
All right. Prof, anything? Okay, before we go and we finish with Rose.
Thanks. Let me see, maybe one or two things that I can just touch on. I think there was Mandela talked about open source or closed source systems. I think I guess that's why we need different players into these discussions. Of course, the academia, we're always trying to push for this, open source, open access. And as academia, what drives us largely many times is actually not on the commercialization aspect, but I think we also need to bring the private sector on board to see how do we take some of these AI models or AI systems that have potential to make money, as you say. So commercialization, I think, that's something to consider. I think Success mentioned something around the generalizability of the AI models. I think there's emerging work on, like artificial general intelligence, which is kind of meant to really build AI models that can do many tasks beyond a single task. I think that's something that's ongoing. On inclusivity, I think this is a big thing. I think fortunately, when you listen to all the different people working on AI now, there's some aspect of responsible AI, inclusion, and all those aspects. For instance, if you're building a large language model, if you go to, I think yesterday I was for something else, I was in Google Translate and I typed in something like Gambian tea, agenda kulabilo mudwade. Don't quote my Luganda. So the Google translates it as he said he's going to look or take care it to a man. So one of the things to think about is then how to ensure that as we're building these models, we are actually ensuring that the data sets and the outputs of the models are not biased or excluding some people of the society.
Thank you very much, sir. And then the last contributor.
Thank you very much for this session. It's really very insightful. I'll tackle a concern on advocacy, and I think it was put forward by a colleague from the School of Public Health. And I think when we talk about advocacy is one of the major things that we really have to do, especially around emerging technologies in a field such as health, and I'm glad that you brought this up. Some of the steps we are taking is actually this one that we are actually engaging in, having conversations across different, sectors, different players, to put forward what artificial intelligence and its capabilities can do. But then again, it shouldn't just stop within this room all on just this day. It has to be an engaging forum where we continue the dialogue away from just this one-day conference, and I think this is just the beginning of its effect. But then again, going down, because advocacy means that whatever tools we're developing have to be impactful to the people down there. And many of those are the ones that are lacking in this room. So what that then means is that can we take the voices from here and then take them down? This usually comes with creating evidence, and I know that through the Makerere AI Health Lab, we've tried as much as we could possibly to create some pieces of evidence. But then can we be able now to take that down there? And one of the things that we're doing is when you look at the African context, like in Uganda, for example, you would realize that when you talk about artificial intelligence, the person down there may not even understand what this really means. So what then that means, can we be again able to leverage on the technology as artificial intelligence to create communication pipelines that our people really understand? Because then if, for example, I want to tell someone about the effect or the importance of artificial intelligence in diagnosing malaria, and the person doesn't really understand the science of artificial intelligence or even understand the English. So can we break it down in ways that we can communicate to them that relates to what they understand and the context? And I think this is not just something we're going to do just in one day. It's one piece at a time. But I think it should be the optimism, the commitment that if we have seen the effects or the good things that are coming out of artificial intelligence, can we be able to now take them down to the bigger population that really understands such? And again, as I re-echo this, conversations should not just stop here, and we could just create a community where these conversations are voiced, but the end goal is to have them reach the people down there, because it all gets back to trust of the solution, but trust comes from, do I understand what you're doing? And I think that's the most critical part. On studies with data, I don't know if I'm getting this question right, but there was a question on, there are some studies that do not have enough data, and I think I just want to quote it from there. There are some studies that may not necessarily have enough data to run an AI model, and we know that most of the artificial intelligence models are really data intensive. So the question was, how can we be able to, one, appreciate the challenge around a given health challenge, but then exist it within the framework that probably we don't even have enough data to run the machine learning model. I know as artificial intelligence has evolved over time, there are different ways we've been doing that, because especially when we want to localize the context of the solution, data is not always there. So how do we begin with that is that there are some, again, technological concepts that we try to leverage on from the AI background. For example, data augmentation. Can we use that to be able to improve the data set? There are also other mechanisms like transfer learning, where a model is able to learn from a bigger data set and then make an inference on a smaller data set. So it's all about leveraging on the technology itself as artificial intelligence, but also the end goal really should be for us to have a data set that is localized. But even within those confines, we want to find as much as possible the different mechanisms and contexts that are within our reach to be able to derive insights out for such shortages. I know this is a growing concern, and there are some, those that I've mentioned that are trying to counter such limitations. But again, I know as artificial intelligence, becomes more advanced, the data option is something that probably in the long run we shall find a very conclusive solution for. But for now, we're just leveraging on those capabilities that come again with the technology itself. I think the other questions around ensuring gender inclusivity, that was ably tackled by Ingine, and I don't want to just repeat myself. Thank you very much.
Thank you all. Let's clap for ourselves. Thank you very much. As we come to a close for this wonderful AI health conference, we need to remember one thing. We are still talking about our main theme on building a strong ecosystem for AI in African health. And we are looking at how we can get these from research perspective into where we come from. As one of our key partners, I would like to recognize the Ministry of ICT and National Governance, and you've also heard it straight from the horse mouth, that is our PS. She has also indicated of that collaboration and the willingness of the ministry to support efforts with this regard. We also thank the Ministry of Health for their continued supporting this movement. I would like to also recognize the participants who came to this event. Please, if I don't mention you, you just shout where you are, then I will shout it properly from my side. I would like to recognize GIZ, Fundibots, Ministry of Health, Ministry of ICT and National Governance, Soroti University, Cavendish University. I would like to recognize Seagram Assurance. I would like to recognize Ernest Cook University of Research Institute. I would like to recognize NITA U. I would like to recognize Baylor. Sorry? Media. How can we forget? These are the usual partners. The Lang Institute, is that not part of Makere or just separate? Yeah, Makere is huge. It has, those enterprises. We'll say, I also come from Cancer Institute. Another one, we are really grateful. And I would like to take this moment to welcome our host, Dr. Rose Nakasi, to give us the closing remarks. So ensure that you enjoy yourself. And more so, connect, get to know each other. So if you're seated somewhere with your grouping during the...
I know we've had a very big following from Ethiopia and from, I think, Switzerland. Conference has just, the beginning is going to be sent out to all the participants of engagement without having any sitting in silos. So we just want to create a forum, a community here in all our different... I want to thank you. I want to thank all our partners.
If you need to know me, you know me already. I'm called Eugene, and I'm here to support. So I'm always happy when Dr. Rose calls me and talks to me about certain things. I've been in this space for quite a while, lecturer at Makere University, mostly with database management systems, and also with Ernest Cook as also a part-timer with the same thing, data stuff. There I also do database business systems and business intelligence aspects. So it's been a wonderful day. Let's continue enjoying ourselves, get to know each other, and we see how life takes us. Good stuff. So those ones who are willing to have, pictures like me right now, you are welcome. Yeah, no, it's okay. Good. So please, those who have not at least had a moment with